1. What is the priority nursing action for a patient experiencing chemotherapy-induced nausea? A. Administer an antiemetic. B. Encourage the patient to drink clear fluids. C. Provide a bland meal. D. Offer the patient a distraction technique. Answer: A. Administer an antiemetic. Rationale: chemotherapy-induced nausea is best managed with antiemetic medications, as they directly target the cause of nausea. While fluids and food may help, they don't address the underlying cause as effectively. 2. A 60-year-old patient is diagnosed with stage 3 lung cancer. What is the most appropriate intervention for managing the patient's pain? A. Administer opioid analgesics as prescribed. B. Suggest relaxation techniques. C. Offer over-the-counter pain relievers. D. Apply heat or cold compresses to the affected area. Answer: A. Administer opioid analgesics as prescribed. Rationale: opioid analgesics are the primary treatment for moderate to severe cancer pain. Non-pharmacological methods may complement pain management, but should not replace opioids when pain is significant. 3. A patient undergoing radiation therapy for breast cancer reports dry skin and redness. What is the most appropriate nursing intervention? A. Apply moisturizing lotion to the affected area. B. Apply a cooling gel to the skin. C. Encourage the patient to wash the area with soap. D. Recommend the patient wear tight clothing. Answer: A. Apply moisturizing lotion to the affected area. Rationale: skin reactions such as dryness and redness are common during radiation therapy. Moisturizing lotion can help soothe the skin and prevent further irritation. Other options may exacerbate skin irritation. 4. What is the priority nursing assessment for a patient receiving chemotherapy who is at risk for neutropenia? A. Monitor the patient's temperature regularly. B. Assess the patient's bowel movements. C. Check for signs of dehydration. D. Perform a neurological assessment. Answer: A. Monitor the patient's temperature regularly. Rationale: neutropenia increases the risk of infection, and fever is often the first sign of infection. Early identification is key to preventing complications. The other assessments are less directly related to infection. 5. A newly diagnosed cancer patient is receiving chemotherapy. What is the most important aspect of patient education regarding treatment side effects? A. Discuss potential hair loss and provide wigs. B. Explain the risk of infection and hygiene precautions. C. Emphasize the importance of physical activity. D. Educate about the likelihood of weight gain. Answer: B. Explain the risk of infection and hygiene precautions. Rationale: chemotherapy can suppress the immune system, increasing the risk of infection. Teaching hygiene precautions helps prevent infections. Hair loss is a concern, but does not directly affect immediate health risks. 6. A patient with colorectal cancer is scheduled for surgery. What is the primary goal of preoperative teaching? A. Ensure the patient understands the need for postoperative pain management. B. Provide information on wound care and stoma care. C. Prepare the patient psychologically for the procedure. D. Discuss the risks and benefits of radiation therapy. Answer: B. Provide information on wound care and stoma care. Rationale: colorectal surgery often involves stoma creation, making stoma care education essential. Psychosocial preparation and pain management are also important, but the primary focus is on postoperative care. 7. A terminally ill cancer patient has requested palliative care. What should the nurse prioritize in this phase? A. Aggressive treatment to prolong life. B. Pain management and symptom relief. C. Surgery to remove cancerous tissue. D. Discuss end-of-life care with the patient's family. Answer: B. Pain management and symptom relief. Rationale: the focus of palliative care is symptom management and providing comfort. While end-of-life discussions are important, managing pain and other symptoms is the priority for quality of life. 8. What is the main function of immunotherapy in treating cancer? A. To prevent the spread of cancer cells. B. To enhance the body's immune system to fight cancer. C. To destroy cancer cells through radiation. D. To remove cancerous tissue surgically. Answer. B. To enhance the body's immune system to fight cancer. Rationale. Immunotherapy works by stimulating the body's immune system to recognize and fight cancer cells. It does not directly destroy cells like radiation or surgery. 9. A patient with breast cancer is experiencing fatigue due to treatment. What is the most appropriate nursing intervention? A. Encourage the patient to engage in light physical activity. B. Recommend the patient sleep as much as possible. C. Increase the patient's fluid intake. D. Limit the patient's activity to prevent exhaustion. Answer. A. Encourage the patient to engage in light physical activity. Rationale. Light physical activity can help reduce fatigue by increasing energy levels and improving overall well-being. While rest is important, complete inactivity can worsen fatigue. 10. A patient with cancer has expressed fear of dying. What is the best approach for the nurse to take? A. Reassure the patient that the cancer treatment will work. B. Offer a spiritual or religious perspective on death. C. Acknowledge the patient's fear and provide a listening ear. D. Change the subject to something more positive. Answer. C. Acknowledge the patient's fear and provide a listening ear. Rationale. Acknowledging the patient's feelings and offering emotional support allows the patient to express their fears and concerns. Reassurance or avoidance is not appropriate at this stage in the conversation. 11. A 45-year-old patient with breast cancer is undergoing chemotherapy. What is the priority intervention to address chemotherapy-induced mucositis? A. Recommend frequent mouth rinses with salt water. B. Offer antiemetic medication for nausea. C. Provide a bland diet. D. Suggest the patient avoid oral hygiene. Answer. A. Recommend frequent mouth rinses with salt water. Rationale. Mucositis is a common side effect of chemotherapy. Saltwater rinses help reduce inflammation and promote healing. Anti-nausea medication is helpful, but does not directly address mucositis. 12. What is the priority nursing intervention for a patient who is newly diagnosed with leukemia and is at risk for bleeding? A. Teach the patient how to perform self-injection of heparin. B. Monitor platelet count and bleeding times. C. Encourage increased physical activity. D. Administer blood products immediately. Answer. B. Monitor platelet count and bleeding times. Rationale. Leukemia can lead to low platelet counts, increasing the risk of bleeding. Monitoring platelet counts is essential for early identification of potential complications. 13. A patient with lung cancer is experiencing difficulty breathing. What is the most appropriate action for the nurse to take? A. Administer supplemental oxygen as prescribed. B. Increase fluid intake to thin mucus. C. Have the patient rest in a flat position. D. Offer the patient a sedative to reduce anxiety. Answer. A. Administer supplemental oxygen as prescribed. Rationale. Difficulty breathing can be caused by hypoxia. Administering oxygen improves oxygenation and relieves symptoms. Fluids and sedatives may not immediately address the respiratory distress. 14. A patient with breast cancer is concerned about hair loss due to chemotherapy. What is the most appropriate response by the nurse? A. Hair loss is temporary, and it will grow back after treatment. B. There are medications to prevent hair loss. C. You can wear a wig or scarf if you feel self-conscious. D. It is unlikely that you'll experience hair loss. Answer. C. You can wear a wig or scarf if you feel self-conscious. Rationale. Providing practical options for coping with hair loss can offer emotional support. Hair loss during chemotherapy is often temporary, but the focus should be on how to manage it emotionally. 15. A patient with stage 4 cancer is receiving palliative care. What is the priority goal of care for this patient? A. To cure the cancer and prolong life. B. To alleviate pain and improve the quality of life. C. To manage the cancer's physical symptoms. D. To provide psychological counseling for the patient. Answer. B. To alleviate pain and improve the quality of life. Rationale. Palliative care focuses on comfort, pain relief, and improving the patient's quality of life, rather than curing the disease. Managing symptoms and supporting emotional well-being are key priorities. 16. A patient with colorectal cancer is receiving chemotherapy. What is the most common side effect of chemotherapy for this patient? A. Hair loss. B. Nausea and vomiting. C. Diarrhea. D. Weight gain. Answer: B. Nausea and vomiting. Rationale: chemotherapy frequently causes nausea and vomiting. Managing this side effect is critical in oncology nursing to improve patient comfort and adherence to treatment. 17. A patient with breast cancer is receiving adjuvant therapy with tamoxifen. What is the most important side effect to monitor for with this medication? A. Weight gain. B. Hot flashes and vaginal dryness. C. Hair loss. D. Muscle weakness. Answer: B. Hot flashes and vaginal dryness. Rationale: tamoxifen is a selective estrogen receptor modulator, SERM, and common side effects include hot flashes and vaginal dryness. These side effects can significantly affect quality of life. 18. A nurse is assessing a 72-year-old patient with prostate cancer. The patient's PSA level is elevated. What does this indicate? A. The cancer is localized and curable. B. The cancer is metastasizing. C. The prostate cancer is in remission. D. The cancer may be progressing or recurrent. Answer: D. The cancer may be progressing or recurrent. Rationale: elevated PSA levels in prostate cancer may indicate disease progression or recurrence. Monitoring PSA levels helps guide treatment decisions and assess for metastasis. 19. What is the best dietary recommendation for a cancer patient undergoing chemotherapy who is experiencing anorexia? A. Offer small, frequent meals with high-protein snacks. B. Encourage a high-fat, low-protein diet. C. Suggest 3 large meals daily. D. Recommend a clear liquid diet. Answer: A. Offer small, frequent meals with high-protein snacks. Rationale: small, frequent meals with high-protein snacks can help improve calorie and protein intake, which is essential for maintaining strength and weight during chemotherapy. 20. A patient with cancer is at risk for neutropenia. What is the most important action for the nurse to prevent infection? A. Administer prescribed antibiotics as needed. B. Encourage hand hygiene and limit visitors. C. Restrict all physical activity. D. Monitor the patient's blood pressure regularly. Answer: B. Encourage hand hygiene and limit visitors. Rationale: neutropenic patients are at high risk for infections, so hand hygiene and limiting visitors help prevent exposure to pathogens. Antibiotics are important, but prevention of infection is the priority. 21. A patient with end-stage cancer is experiencing difficulty breathing. What is the best nursing intervention to manage this symptom? A. Administer morphine as prescribed. B. Offer a sedative to calm the patient. C. Apply oxygen therapy. D. Provide psychological counseling. Answer: A. Administer morphine as prescribed. Rationale: morphine is commonly used in end-stage cancer for symptom management, including difficulty breathing. It helps reduce the sensation of air hunger and alleviates discomfort. 22. A patient receiving chemotherapy for lung cancer asks the nurse about the expected duration of treatment. What is the nurse's best response? A. Treatment will last until the cancer is cured. B. Chemotherapy is usually a short-term treatment, typically 3 to 6 months. C. Chemotherapy will continue until you experience severe side effects. D. The duration will depend on your individual response to treatment. Answer: D. The duration will depend on your individual response to treatment. Rationale: the duration of chemotherapy varies based on individual response, the type and stage of cancer, and the treatment protocol. Providing individualized information helps manage expectations. 23. A patient with a history of colon cancer is being prepared for a colonoscopy. What should the nurse include in the pre-procedure teaching? A. You will need to refrain from eating solid food for 24 hours before the procedure. B. You will be given general anesthesia for the procedure. C. You must take a bowel prep medication to clear your intestines. D. There is no need to alter your usual diet. Answer: C. You must take a bowel prep medication to clear your intestines. Rationale: proper bowel preparation is essential for a clear view during colonoscopy. The patient must be informed about dietary restrictions and bowel prep medications. 24. A nurse is caring for a patient with lung cancer who is undergoing radiation therapy. What is the priority nursing action to reduce the side effects of radiation? A. Apply moisturizing cream to the skin over the irradiated area. B. Administer pain medication for chest discomfort. C. Teach the patient deep breathing exercises. D. Encourage the patient to increase physical activity. Answer: A. Apply moisturizing cream to the skin over the irradiated area. Rationale: radiation therapy can cause skin irritation, so applying moisturizing cream helps soothe and protect the skin. Pain management and breathing exercises are helpful, but moisturizing is the priority. 25. A 60-year-old patient is diagnosed with metastatic liver cancer. What is the most appropriate goal of care at this stage? A. Cure the cancer through surgery and chemotherapy. B. Control the cancer growth and alleviate symptoms. C. Provide palliative care only. D. Offer alternative therapies to the patient. Answer: B. Control the cancer growth and alleviate symptoms. Rationale: in metastatic liver cancer, the goal is often to control the cancer's spread and manage symptoms. Cure is typically not possible at this stage, so symptom relief and quality of life are prioritized. 26. A patient with cancer is receiving immunotherapy and develops a rash. What should the nurse do first? A. Document the rash and continue monitoring. B. Administer a prescribed antihistamine. C. Notify the healthcare provider immediately. D. Apply a corticosteroid cream. Answer: C. Notify the healthcare provider immediately. Rationale: a rash may indicate an allergic reaction or other side effects related to immunotherapy. Immediate communication with the healthcare provider is necessary to assess the severity and initiate appropriate treatment. 27. A patient with cancer is receiving opioids for pain management. What is the most important assessment for the nurse to monitor? A. The patient's level of consciousness. B. The patient's respiratory rate. C. The patient's blood pressure. D. The patient's temperature. Answer: B. The patient's respiratory rate. Rationale: opioids can depress the respiratory system, so it is critical to monitor respiratory rate. Changes in consciousness and blood pressure are also important, but respiratory function is the priority with opioids. 28. A patient receiving chemotherapy is at risk for infection. What is the most appropriate nursing action to prevent infection? A. Teach the patient to practice proper hand hygiene. B. Restrict all visitors. C. Administer antibiotics prophylactically. D. Limit the patient's activity to bed rest. Answer: A. Teach the patient to practice proper hand hygiene. Rationale: proper hand hygiene is a critical infection prevention measure, especially for immunocompromised patients. Limiting visitors and administering antibiotics may be part of care, but hand hygiene is most effective. 29. A patient with esophageal cancer is experiencing difficulty swallowing. What is the most appropriate intervention? A. Provide the patient with soft, easy-to-swallow foods. B. Recommend the patient eat larger meals. C. Encourage the patient to drink carbonated beverages. D. Advise the patient to use a straw when drinking. Answer: A. Provide the patient with soft, easy-to-swallow foods. Rationale: soft, moist foods are easier to swallow for patients with esophageal cancer. Larger meals, carbonated beverages, and using a straw may make swallowing more difficult. 30. A nurse is caring for a terminally ill cancer patient who is refusing food. What is the most appropriate response? A. You need to eat to maintain strength. B. It's okay not to eat if you're not hungry. C. If you don't eat, you'll get weaker. D. Eating is essential for your treatment to work. Answer: B. It's okay not to eat if you're not hungry. Rationale. In end-of-life care, respecting the patient's wishes and comfort is paramount. Forcing food may cause distress, so it is important to offer emotional support and allow the patient to make decisions. 31. A patient with ovarian cancer is receiving chemotherapy. What is the most common side effect of chemotherapy for this patient? A. Weight loss. B. Nausea and vomiting. C. Peripheral neuropathy. D. Alopecia. Answer. B. Nausea and vomiting. Rationale. Chemotherapy for ovarian cancer commonly causes nausea and vomiting due to the toxic effects on rapidly dividing cells in the gastrointestinal tract. 32. A patient with prostate cancer is experiencing urinary retention. What is the priority intervention? A. Encourage increased fluid intake. B. Perform a bladder scan to assess for retention. C. Insert a Foley catheter. D. Provide medications to relieve pain. Answer. B. Perform a bladder scan to assess for retention. Rationale. Urinary retention is common in prostate cancer due to the tumor's effect on urinary function. A bladder scan helps assess the severity before deciding on other interventions like catheterization. 33. A patient undergoing radiation therapy for breast cancer is at risk for skin breakdown. What should the nurse do? A. Apply a thick layer of petroleum jelly on the skin. B. Teach the patient to keep the skin clean and dry. C. Advise the patient to avoid any skin care. D. Use hot packs to soothe the skin. Answer. B. Teach the patient to keep the skin clean and dry. Rationale. Radiation therapy can irritate the skin. Keeping the skin clean and dry helps prevent infection and skin breakdown. Petroleum jelly and hot packs may worsen irritation. 34. A patient with cancer is receiving opioid analgesics for pain management. Which of the following should the nurse monitor for? A. Diarrhea. B. Bradycardia. C. Respiratory depression. D. Hypertension. Answer. C. Respiratory depression. Rationale. Opioids can cause respiratory depression, which is a serious and potentially life-threatening side effect. Monitoring respiratory rate is critical for patients on opioid therapy. 35. A patient is being discharged following surgery for oral cancer. What is the most important teaching to provide? A. Use mouthwash with alcohol to prevent infections. B. Ensure that you follow up with speech and swallowing therapy. C. You can return to normal activities immediately. D. You should avoid drinking fluids for 24 hours. Answer. B. Ensure that you follow up with speech and swallowing therapy. Rationale. Oral cancer surgery can affect speech and swallowing, so follow-up with therapy is important for recovery and maintaining function. Alcohol-based mouthwash may irritate the surgical site. 36. A patient with lung cancer is experiencing cachexia. What is the priority nursing intervention? A. Provide high-calorie, high-protein meals. B. Limit fluid intake to reduce bloating. C. Encourage the patient to rest frequently. D. Administer antidiarrheal medications. Answer. A. Provide high-calorie, high-protein meals. Rationale. Cachexia, or muscle wasting, is common in cancer patients. Providing high-calorie and high-protein meals helps improve nutritional intake and prevent further weight loss. 37. A patient receiving chemotherapy has developed mouth sores. What is the most effective intervention to manage this symptom? A. Offer mouth rinses with salt water. B. Apply a topical antibiotic ointment. C. Recommend sucking on hard candies. D. Suggest a liquid diet only. Answer. A. Offer mouth rinses with salt water. Rationale. Mouth sores are a common side effect of chemotherapy. Saltwater rinses help cleanse the mouth, reduce inflammation, and prevent infection, offering relief for mouth sores. 38. A patient with cancer is experiencing fatigue. What is the best intervention to improve the patient's energy level? A. Encourage regular exercise, such as walking. B. Provide stimulant medications to boost energy. C. Recommend the patient take multiple naps throughout the day. D. Advise the patient to rest in bed for most of the day. Answer. A. Encourage regular exercise, such as walking. Rationale. While rest is important, regular light exercise like walking helps improve energy levels and reduces fatigue in cancer patients, promoting overall well-being. 39. A patient with lymphoma is receiving radiation therapy. Which of the following interventions should the nurse include in the care plan? A. Use soap and water to clean the skin over the irradiated area. B. Apply lotions containing alcohol to the irradiated skin. C. Teach the patient to protect the skin from the sun. D. Advise the patient to take hot showers to soothe the skin. Answer. C. Teach the patient to protect the skin from the sun. Rationale. Radiation therapy can make the skin more sensitive to the sun. Patients should be advised to protect the skin from sunlight to avoid further damage and irritation. 40. A patient with colorectal cancer is receiving chemotherapy and reports difficulty swallowing. What should the nurse recommend? A. Drink plenty of fluids to help with swallowing. B. Take small, frequent sips of liquid with meals. C. Use a feeding tube for all nutrition. D. Chew food thoroughly and take large bites. Answer. B. Take small, frequent sips of liquid with meals. Rationale. Difficulty swallowing, dysphagia, can be managed by taking small sips of liquids. This prevents choking and promotes safe swallowing. Large bites or a feeding tube may not be necessary initially. 41. A patient is receiving chemotherapy and is at risk for neutropenia. Which of the following should the nurse instruct the patient to avoid? A. Large crowds and people with infections. B. Eating a high-protein diet. C. Using a humidifier in the home. D. Drinking fresh fruit juices. Answer. A. Large crowds and people with infections. Rationale. Neutropenia makes the patient vulnerable to infections, so avoiding crowds and people who are ill is essential to reduce the risk of exposure. A high-protein diet can support immune function. 42. A patient with lung cancer is experiencing severe pain. Which of the following is the most appropriate initial intervention? A. Administer prescribed opioids for pain relief. B. Apply a hot compress to the affected area. C. Provide relaxation techniques to manage pain. D. Encourage the patient to walk for pain relief. Answer. A. Administer prescribed opioids for pain relief. Rationale. Opioids are the most effective treatment for severe cancer pain, providing quick relief. Non-pharmacologic methods may be used in conjunction, but should not replace analgesic medications for severe pain. 43. A patient with metastatic melanoma is receiving targeted therapy. What is the most common side effect of this treatment? A. Diarrhea. B. Weight gain. C. Hair loss. D. Skin rash. Answer. D. Skin rash. Rationale. Skin rash is a common side effect of targeted therapies, particularly those for melanoma. Monitoring for and managing this side effect is crucial in providing care. 44. A patient undergoing radiation therapy for throat cancer is complaining of dry mouth. What is the best intervention? A. Encourage the patient to chew gum. B. Recommend the use of a saliva substitute. C. Suggest the patient drink caffeinated beverages. D. Provide vitamin C supplements. Answer. B. Recommend the use of a saliva substitute. Rationale. Radiation therapy can cause xerostomia, dry mouth. Using a saliva substitute helps manage this side effect. Chewing gum may help but isn't as effective as a substitute specifically designed for dry mouth. 45. A nurse is caring for a patient with cancer who is receiving chemotherapy. The patient is experiencing nausea and vomiting. Which of the following interventions should the nurse prioritize? A. Administer antiemetic medications as prescribed. B. Offer small, frequent meals to prevent nausea. C. Restrict the patient's fluid intake to prevent vomiting. D. Encourage the patient to sleep for several hours. Answer. A. Administer antiemetic medications as prescribed. Rationale. Antiemetic medications are the first-line treatment for nausea and vomiting associated with chemotherapy. They provide effective relief to improve patient comfort. 46. A patient with cancer is experiencing anxiety about the prognosis. What is the best response by the nurse? A. Don't worry, everything will be fine. B. It's important to stay positive and think about treatment. C. It's normal to feel anxious. Let's talk about your concerns. D. You should try not to think about the prognosis. Answer: C. It's normal to feel anxious. Let's talk about your concerns. Rationale: acknowledging the patient's anxiety and providing a supportive environment to discuss concerns helps reduce fear and provides emotional support. Offering empty reassurances can invalidate the patient's feelings. 47. A patient with lymphoma is experiencing pain in the chest area due to enlarged lymph nodes. What is the priority nursing intervention? A. Administer prescribed pain medications. B. Apply heat to the affected area. C. Encourage deep breathing exercises to reduce discomfort. D. Encourage the patient to avoid lying down. Answer: A. Administer prescribed pain medications. Rationale: the priority intervention is pain management. Administering prescribed pain medications helps alleviate discomfort and improve the patient's quality of life. 48. A nurse is caring for a patient with leukemia. The patient is at high risk for bleeding. What should the nurse monitor for? A. Sudden weight gain. B. Petechiae and bruising. C. Increased urine output. D. Nausea and vomiting. Answer: B. Petechiae and bruising. Rationale: leukemia can cause low platelet counts, leading to increased risk of bleeding. Monitoring for signs such as petechiae, small red spots under the skin, and bruising is crucial. 49. A patient with colon cancer is receiving palliative care. What is the focus of care at this stage? A. Cure the cancer and extend survival. B. Provide comfort and relieve symptoms. C. Administer chemotherapy to shrink tumors. D. Focus on preventing further metastasis. Answer: B. Provide comfort and relieve symptoms. Rationale: palliative care focuses on relieving symptoms and providing comfort rather than curing the disease. This approach is aimed at improving the quality of life for patients with advanced cancer. 50. A patient with breast cancer is receiving chemotherapy and is experiencing a decrease in white blood cell count. What is the priority nursing action? A. Provide a high-protein diet to boost immune function. B. Encourage the patient to rest and avoid exercise. C. Implement infection control precautions. D. Administer growth factor medications. Answer: C. Implement infection control precautions. Rationale: a low white blood cell count increases the risk of infection. Infection control precautions are essential to protect the patient from potential infections while their immune system is compromised. 51. A patient with advanced lung cancer is receiving hospice care. Which of the following is the priority goal of care? A. Cure the cancer. B. Provide pain relief and comfort. C. Perform aggressive treatments to extend life. D. Administer chemotherapy to control the disease. Answer: B. Provide pain relief and comfort. Rationale: in hospice care, the primary focus is on providing comfort and relieving symptoms, not curing the disease or performing aggressive treatments. 52. A patient with cancer is experiencing severe nausea and vomiting. What is the nurse's priority intervention? A. Offer clear fluids only. B. Administer prescribed antiemetic medications. C. Encourage small meals and snacks. D. Increase the patient's fluid intake. Answer: B. Administer prescribed antiemetic medications. Rationale: the first step in managing severe nausea and vomiting from chemotherapy is to administer antiemetic medications as prescribed. 53. A patient with leukemia is at risk for infection. What should the nurse include in the care plan? A. Provide a high-fiber diet to boost immunity. B. Restrict all visitors, including family. C. Perform frequent hand hygiene and wear gloves. D. Keep the patient in a private room without any visitors. Answer: C. Perform frequent hand hygiene and wear gloves. Rationale: Protecting the patient from infection is essential, and frequent hand hygiene and the use of gloves help minimize the risk of transmission. 54. A nurse is caring for a patient undergoing radiation therapy. What is the most important action to prevent skin irritation in the irradiated area? A. Apply aloe vera gel to the skin. B. Use a mild soap to cleanse the skin. C. Expose the skin to direct sunlight. D. Apply hot compresses to the skin. Answer. B. Use a mild soap to cleanse the skin. Rationale. Using a mild soap helps minimize irritation in the skin that is undergoing radiation therapy. Avoiding sun exposure and hot compresses are also crucial for preventing further skin irritation. 55. A patient is receiving chemotherapy and is at risk for mucositis. What is the nurse's priority intervention? A. Encourage the patient to drink hot beverages. B. Teach the patient to use mouth rinses with salt water. C. Instruct the patient to avoid brushing their teeth. D. Recommend using mouthwash containing alcohol. Answer. B. Teach the patient to use mouth rinses with salt water. Rationale. Saltwater mouth rinses help soothe and cleanse the mouth, reducing inflammation and preventing infection in patients with chemotherapy-induced mucositis. 56. A nurse is teaching a patient with prostate cancer about hormonal therapy. Which statement indicates the patient understands the teaching? A. Hormonal therapy will shrink the tumor. B. Hormonal therapy will stop the cancer from spreading. C. Hormonal therapy will help reduce the size of the prostate. D. Hormonal therapy will help manage symptoms and reduce tumor growth. Answer. D. Hormonal therapy will help manage symptoms and reduce tumor growth. Rationale. Hormonal therapy for prostate cancer is aimed at reducing symptoms and slowing tumor growth, rather than curing the disease. 57. A nurse is caring for a patient with colorectal cancer who is scheduled for surgery. What is the priority preoperative teaching? A. Discuss the risks of radiation therapy. B. Explain the need for bowel preparation. C. Encourage the patient to stop taking all medications. D. Teach about the importance of postoperative pain control. Answer. B. Explain the need for bowel preparation. Rationale. Bowel preparation is necessary before colorectal surgery to clear the intestines for optimal surgical outcomes. This teaching is a priority in the preoperative phase. 58. A patient with oral cancer is receiving chemotherapy and is experiencing dry mouth. What should the nurse recommend? A. Suck on sour candies. B. Drink caffeinated beverages. C. Use a saliva substitute. D. Avoid drinking water. Answer. C. Use a saliva substitute. Rationale. Chemotherapy can cause xerostomia, dry mouth. A saliva substitute helps relieve the discomfort and prevents complications like difficulty swallowing and speaking. 59. A patient with cancer is experiencing fatigue. Which intervention should the nurse recommend to help manage this symptom? A. Encourage frequent naps during the day. B. Provide energy drinks. C. Encourage a balanced diet with small, frequent meals. D. Encourage the patient to remain in bed most of the time. Answer. C. Encourage a balanced diet with small, frequent meals. Rationale. A balanced diet with small, frequent meals can help improve energy levels and manage fatigue. Encouraging bed rest may exacerbate the feeling of fatigue. 60. A patient with breast cancer is experiencing lymphedema after a mastectomy. What should the nurse teach the patient? A. Keep the affected arm elevated. B. Perform vigorous exercise with the affected arm. C. Apply heat to the affected area. D. Keep the affected arm immobilized. Answer. A. Keep the affected arm elevated. Rationale. Elevating the affected arm helps reduce swelling in patients with lymphedema following mastectomy. Vigorous exercise and heat may worsen the swelling. 61. A nurse is caring for a patient with advanced ovarian cancer. Which symptom is most likely to occur due to the progression of the disease? A. Fever. B. Abdominal bloating and discomfort. C. Sudden weight loss. D. Severe headache. Answer. B. abdominal bloating and discomfort. Rationale: ovarian cancer often causes abdominal bloating and discomfort as the tumor grows and places pressure on surrounding structures. Fever is not a typical symptom of advanced ovarian cancer. 62. A nurse is providing care for a patient with end-stage cancer who is experiencing severe pain. What is the priority nursing action? A. Administer opioid analgesics as prescribed. B. Reposition the patient for comfort. C. Provide distraction techniques. D. Encourage deep breathing exercises. Answer: A. Administer opioid analgesics as prescribed. Rationale: the priority action for managing severe cancer pain is to administer opioid analgesics as prescribed, ensuring effective pain relief. Other interventions can supplement pain management. 63. A nurse is caring for a patient with head and neck cancer. What is a common side effect of radiation therapy in this patient? A. Dry mouth, xerostomia. B. Excessive salivation. C. Weight gain. D. Increased appetite. Answer: A. Dry mouth, xerostomia. Rationale: radiation therapy for head and neck cancer often causes xerostomia, dry mouth, due to damage to salivary glands. This requires management with saliva substitutes and hydration. 64. A patient with cancer is experiencing constipation due to chemotherapy. What is the best nursing intervention? A. Administer a stool softener as prescribed. B. Increase the patient's fluid intake. C. Restrict the patient's diet to low-fiber foods. D. Encourage the patient to avoid physical activity. Answer: A. Administer a stool softener as prescribed. Rationale: constipation is a common side effect of chemotherapy. Administering stool softeners helps relieve this symptom and prevent complications. 65. A patient with leukemia is undergoing chemotherapy and develops fever and chills. What is the nurse's priority action? A. Administer the next dose of chemotherapy. B. Notify the healthcare provider and obtain cultures. C. Apply cool compresses to the patient's forehead. D. Encourage increased fluid intake. Answer: B. Notify the healthcare provider and obtain cultures. Rationale: fever and chills may indicate an infection, a common complication of chemotherapy. The priority is to notify the healthcare provider and obtain cultures to identify the infection and initiate treatment. 66. A patient with colon cancer is scheduled for a colostomy. What is the priority preoperative teaching? A. Teach the patient about the procedure and its purpose. B. Provide information about the chemotherapy regimen. C. Advise the patient to avoid all solid foods before surgery. D. Instruct the patient to discontinue all medications. Answer: A. Teach the patient about the procedure and its purpose. Rationale: it is essential to educate the patient about the colostomy procedure and its purpose to reduce anxiety and ensure the patient understands the postoperative care and lifestyle changes. 67. A patient with leukemia is undergoing a bone marrow biopsy. What is the priority nursing action after the procedure? A. Apply a warm compress to the biopsy site. B. Monitor the patient for signs of infection. C. Apply pressure to the biopsy site to control bleeding. D. Encourage the patient to ambulate immediately. Answer: C. Apply pressure to the biopsy site to control bleeding. Rationale: the priority after a bone marrow biopsy is to apply pressure to the biopsy site to control bleeding, as this is a common complication. Close monitoring for signs of infection follows. 68. A patient with cancer is experiencing anorexia and weight loss. What is the priority nursing intervention? A. Offer high-calorie foods frequently. B. Provide a low-protein diet to minimize strain. C. Encourage fluid restriction to reduce bloating. D. Offer bland, low-fat foods. Answer: A. Offer high-calorie foods frequently. Rationale: offering high-calorie foods frequently helps to combat anorexia and weight loss in cancer patients. This promotes weight maintenance and provides adequate nutrition. 69. A nurse is caring for a patient with leukemia who is undergoing chemotherapy. What should the nurse monitor for regarding complications? A. Elevated blood pressure. B. Decreased platelet count. C. Increased blood sugar levels. D. Increased respiratory rate. Answer. B. Decreased platelet count. Rationale. Chemotherapy often causes myelosuppression, leading to a decrease in platelet count. This increases the risk for bleeding and requires close monitoring. 70. A nurse is caring for a patient with pancreatic cancer. What is the priority intervention for managing pain in this patient? A. Encourage the patient to use relaxation techniques. B. Administer prescribed pain medications as needed. C. Offer a high-protein diet to support healing. D. Promote deep breathing exercises. Answer. B. Administer prescribed pain medications as needed. Rationale. The priority intervention for managing pain in a patient with pancreatic cancer is to administer prescribed pain medications. Pain management is essential in improving the patient's quality of life. 71. A nurse is caring for a patient receiving radiation therapy for head and neck cancer. What is the priority nursing intervention to prevent side effects? A. Encourage the patient to use mouthwash with alcohol. B. Teach the patient to avoid hot foods and drinks. C. Encourage the patient to perform vigorous exercise. D. Apply a heating pad to the affected area. Answer. B. Teach the patient to avoid hot foods and drinks. Rationale. Radiation therapy can cause mucositis and oral dryness. Avoiding hot foods and drinks prevents further irritation to the mouth and throat. 72. A patient with breast cancer is receiving chemotherapy and experiences severe nausea. What is the priority nursing action? A. Offer small, frequent meals. B. Administer antiemetic medications as prescribed. C. Encourage the patient to drink ginger tea. D. Provide a comfortable environment with dim lighting. Answer. B. Administer antiemetic medications as prescribed. Rationale. Antiemetic medications should be administered as prescribed to manage nausea and vomiting caused by chemotherapy. Other interventions can be used as adjuncts. 73. A nurse is caring for a patient with lung cancer who is experiencing dyspnea. What is the priority nursing intervention? A. Administer oxygen therapy as prescribed. B. Encourage deep breathing exercises. C. Provide a humidifier in the room. D. Encourage the patient to sit up and lean forward. Answer. A. Administer oxygen therapy as prescribed. Rationale. The priority intervention for dyspnea in a patient with lung cancer is to administer oxygen therapy as prescribed to alleviate hypoxia and ease breathing. 74. A patient with colon cancer is undergoing chemotherapy and develops diarrhea. What should the nurse include in the care plan? A. Restrict the patient's fluid intake. B. Administer antidiarrheal medications as prescribed. C. Encourage the patient to consume high-fiber foods. D. Provide the patient with clear liquids only. Answer. B. Administer antidiarrheal medications as prescribed. Rationale. Diarrhea is a common side effect of chemotherapy. Administering antidiarrheal medications helps manage the condition and prevent dehydration. 75. A nurse is providing care to a patient with breast cancer who is undergoing radiation therapy. Which of the following instructions should the nurse give to reduce skin irritation? A. Apply lotion with alcohol to the irradiated skin. B. Use a mild soap and avoid scrubbing the skin. C. Expose the skin to direct sunlight for healing. D. Apply heat to the irradiated area. Answer. B. Use a mild soap and avoid scrubbing the skin. Rationale. Using mild soap and avoiding scrubbing prevents further irritation of the skin undergoing radiation therapy. Excessive heat or sun exposure can worsen skin irritation. 76. A nurse is caring for a patient with advanced cancer who is experiencing pain. Which of the following is the most appropriate intervention? A. Administer opioid analgesics as prescribed. B. Encourage deep breathing exercises. C. Provide a warm compress to the painful area. D. Suggest acupuncture for pain relief. Answer. A. Administer opioid analgesics as prescribed. Rationale. Opioid analgesics are the most effective way to manage severe cancer pain. Other interventions can complement pain relief, but should not replace opioid therapy for moderate to severe pain. 77. A nurse is caring for a patient with leukemia who is receiving chemotherapy. The patient has developed neutropenia. What is the priority nursing action? A. Place the patient in a private room. B. Restrict all visitors, including family. C. Encourage frequent hand hygiene and use of gloves. D. Administer a blood transfusion. Answer: C. Encourage frequent hand hygiene and use of gloves. Rationale: neutropenia increases the patient's risk for infection. Hand hygiene and the use of gloves help reduce the risk of infection. Isolation and visitor restrictions are also important, but hygiene is the first line of defense. 78. A nurse is teaching a patient with prostate cancer about the side effects of hormone therapy. Which of the following statements indicates that the patient understands the teaching? A. I may experience a decrease in sexual desire. B. My energy levels will increase with hormone therapy. C. Hormone therapy will help me gain weight. D. I will feel more energetic during hormone therapy. Answer: A. I may experience a decrease in sexual desire. Rationale: hormone therapy for prostate cancer often leads to decreased libido as a common side effect. Patients need to be informed about this potential outcome. 79. A nurse is caring for a patient who is receiving chemotherapy for leukemia. Which of the following findings should the nurse report immediately? A. Decreased appetite and weight loss. B. Temperature of 101.4 degrees Fahrenheit 38.6 degrees Celsius. C. Diarrhea and nausea. D. Fatigue and malaise. Answer: B. Temperature of 101.4 degrees Fahrenheit 38.6 degrees Celsius. Rationale: a fever of 101.4 degrees Fahrenheit 38.6 degrees Celsius in a patient undergoing chemotherapy is indicative of an infection, which requires immediate intervention, especially since the patient may be immunocompromised. 80. A patient with esophageal cancer is receiving radiation therapy. Which of the following instructions should the nurse give to the patient? A. You can eat any foods you want. B. Avoid eating hot and spicy foods. C. It is okay to drink alcohol while receiving treatment. D. You should increase your intake of red meats. Answer: B. Avoid eating hot and spicy foods. Rationale: radiation therapy can cause irritation to the esophagus, and hot or spicy foods may exacerbate this irritation. Patients should be instructed to avoid these foods. 81. A patient with lung cancer is experiencing severe pain and requires opioid medication. What is the nurse's priority assessment before administering the medication? A. Assess the patient's respiratory rate. B. Assess the patient's blood pressure. C. Assess the patient's pain level. D. Assess the patient's level of consciousness. Answer: A. Assess the patient's respiratory rate. Rationale: opioid medications can depress the respiratory system. The nurse should assess the respiratory rate to ensure the patient can tolerate the medication without respiratory compromise. 82. A nurse is providing education to a patient undergoing chemotherapy about managing hair loss. Which of the following should be included in the teaching? A. Wear a wig or scarf if you feel self-conscious. B. Hair loss is permanent with chemotherapy. C. Hair loss can be prevented with medication. D. There are no ways to manage hair loss during chemotherapy. Answer: A. Wear a wig or scarf if you feel self-conscious. Rationale: hair loss is a common side effect of chemotherapy, and patients can manage the emotional impact by wearing wigs, scarves, or hats if they choose. 83. A nurse is caring for a patient with a newly diagnosed brain tumor. What should the nurse assess first? A. Neurological status. B. Nutritional status. C. Pain level. D. Respiratory status. Answer: A. Neurological status. Rationale: the first priority in a patient with a brain tumor is to assess the neurological status to determine the extent of the tumor's effect on the brain and plan appropriate interventions. 84. A nurse is caring for a patient with pancreatic cancer. Which of the following findings is most concerning? A. Jaundice and dark urine. B. Abdominal pain and weight loss. C. Nausea and vomiting. D. Increased thirst and urination. Answer: A. Jaundice and dark urine. Rationale: jaundice and dark urine can indicate a blockage in the bile duct, which is a common complication of pancreatic cancer and requires immediate assessment and intervention. 85. A nurse is caring for a patient with a history of colon cancer who is experiencing rectal bleeding. What is the nurse's priority action? A. Notify the healthcare provider immediately. B. Administer a stool softener. C. Provide a diet high in fiber. D. Encourage increased fluid intake. Answer: A. Notify the healthcare provider immediately. Rationale: rectal bleeding in a patient with a history of colon cancer is concerning and requires prompt notification of the healthcare provider to assess the cause and initiate appropriate interventions. 86. A nurse is caring for a patient with leukemia who has thrombocytopenia. Which of the following should the nurse include in the patient's care plan? A. Monitor for signs of bleeding. B. Provide a high-fiber diet. C. Administer anticoagulants as prescribed. D. Encourage frequent ambulation. Answer: A. Monitor for signs of bleeding. Rationale: thrombocytopenia increases the risk of bleeding, so it is crucial to monitor for signs of bleeding and intervene as needed. Other interventions may also be necessary, but bleeding precautions are the priority. 87. A nurse is caring for a patient receiving chemotherapy. Which of the following findings should be reported immediately? A. Anemia with a hemoglobin level of 10G/DL. B. Oral mucositis with painful mouth sores. C. A temperature of 100.4 degrees Fahrenheit 38 degrees Celsius. D. Fatigue and malaise. Answer: C. A temperature of 100.4 degrees Fahrenheit 38 degrees Celsius. Rationale: a temperature of 100.4 degrees Fahrenheit 38 degrees Celsius in a patient receiving chemotherapy could indicate an infection, which requires immediate intervention due to the risk of neutropenia and immune suppression. 88. A patient with prostate cancer is receiving hormone therapy. Which of the following should the nurse include in the teaching plan? A. You may experience weight gain due to fluid retention. B. Hormone therapy will prevent your cancer from spreading. C. You will be at increased risk for osteoporosis. D. The treatment may cause your hair to grow faster. Answer: C. You will be at increased risk for osteoporosis. Rationale: hormone therapy for prostate cancer reduces testosterone levels, increasing the risk of osteoporosis. Weight gain and hair growth are not common side effects. 89. A nurse is caring for a patient with colon cancer who is postoperative day 2 following a colectomy. What is the priority nursing action? A. Assess bowel sounds and abdominal distension. B. Encourage the patient to ambulate. C. Administer prescribed pain medications. D. Monitor the patient's wound for signs of infection. Answer: A. Assess bowel sounds and abdominal distension. Rationale: after a colectomy, the nurse should assess bowel sounds and for abdominal distension to evaluate for potential complications such as ileus or bowel obstruction. Other actions are also important, but not the priority. 90. A nurse is caring for a patient undergoing chemotherapy and reports a sudden onset of chest pain. What is the nurse's priority action? A. Administer nitroglycerin as prescribed. B. Assess the patient's vital signs and oxygen saturation. C. Encourage the patient to take deep breaths. D. Call for a cardiology consult immediately. Answer: B. Assess the patient's vital signs and oxygen saturation. Rationale: the nurse should first assess vital signs and oxygen saturation to determine if the chest pain is related to a cardiovascular issue, as chemotherapy can increase the risk of cardiovascular events. 91. A nurse is caring for a patient receiving chemotherapy for lung cancer. The patient reports feeling very fatigued. Which of the following is the priority action? A. Administer a dose of vitamin B12 as prescribed. B. Encourage the patient to rest and conserve energy. C. Increase the patient's fluid intake. D. Have the patient perform light physical activity. Answer: B. Encourage the patient to rest and conserve energy. Rationale: fatigue is a common side effect of chemotherapy. The nurse should encourage the patient to rest and conserve energy. Increasing fluids and vitamin B12 may help, but rest is the priority. 92. A patient with esophageal cancer is receiving radiation therapy. Which of the following interventions should the nurse include in the care plan to prevent mucositis? A. Encourage the patient to drink acidic beverages. B. Teach the patient to use alcohol-based mouthwash. C. Recommend the use of soft, bland foods. D. Advise the patient to avoid oral care during treatment. Answer: C. Recommend the use of soft, bland foods. Rationale: mucositis is a common side effect of radiation therapy. Soft, bland foods are less irritating to the mucosa. Acidic foods and alcohol-based mouthwashes can worsen mucositis. 93. A nurse is caring for a patient who is receiving chemotherapy and has developed neutropenia. Which of the following is the priority nursing intervention? A. Monitor the patient's white blood cell count daily. B. Administer prescribed antibiotics for fever. C. Encourage the patient to maintain good oral hygiene. D. Place the patient on a high-calorie diet. Answer: B. Administer prescribed antibiotics for fever. Rationale: neutropenic patients are at high risk for infection. A fever could indicate an infection, and administering antibiotics as prescribed is the priority. Other actions are also important, but infection control comes first. 94. A nurse is caring for a patient with colon cancer who is experiencing bowel obstruction. What is the priority action? A. Place the patient on a low-residue diet. B. Administer pain medications as prescribed. C. Insert a nasogastric tube for decompression. D. Encourage the patient to walk around the room. Answer: C. Insert a nasogastric tube for decompression. Rationale: a nasogastric tube is used to decompress the stomach and relieve symptoms of bowel obstruction. Pain management and dietary changes are also important but not as urgent. 95. A nurse is caring for a patient who is receiving chemotherapy for breast cancer. The patient reports feeling nauseated and has vomited several times. Which of the following is the priority intervention? A. Administer an antiemetic medication as prescribed. B. Encourage the patient to drink ginger tea. C. Offer small, frequent meals. D. Provide the patient with ice chips to suck on. Answer: A. Administer an antiemetic medication as prescribed. Rationale: the priority intervention for nausea and vomiting related to chemotherapy is to administer an antiemetic medication as prescribed to control symptoms. Other interventions can be used as adjuncts. 96. A nurse is caring for a patient with advanced cancer who is receiving palliative care. What is the primary goal of palliative care? A. To cure the cancer and prolong life. B. To provide symptom relief and improve quality of life. C. To treat the cancer with the latest therapies. D. To prepare the patient for surgery. Answer: B. To provide symptom relief and improve quality of life. Rationale: palliative care focuses on symptom management and improving the patient's quality of life, rather than curing the cancer or prolonging life. It addresses physical, emotional, and spiritual needs. 97. A nurse is providing care to a patient receiving chemotherapy who reports difficulty swallowing. What is the nurse's priority intervention? A. Assess for oral mucositis or sores. B. Offer soft, easy-to-swallow foods. C. Teach the patient swallowing exercises. D. Encourage the patient to drink liquids with meals. Answer: A. Assess for oral mucositis or sores. Rationale: difficulty swallowing may be caused by mucositis or other side effects of chemotherapy. The nurse should assess the oral cavity for sores or other signs of mucosal damage. 98. A patient with cancer is receiving immunotherapy. Which of the following is an expected side effect of this treatment? A. Constipation. B. Hair loss. C. Flu-like symptoms. D. Increased appetite. Answer: C. Flu-like symptoms. Rationale: immunotherapy can cause flu-like symptoms such as fever, chills, and fatigue due to the immune system's response to the therapy. Hair loss and constipation are more common with chemotherapy, not immunotherapy. 99. A nurse is caring for a patient receiving chemotherapy who is at risk for infection. Which of the following should the nurse include in the patient's plan of care? A. Encourage the patient to drink only bottled water. B. Keep the patient's environment free of fresh flowers. C. Encourage the patient to participate in group activities. D. Administer prophylactic antibiotics routinely. Answer: B. Keep the patient's environment free of fresh flowers. Rationale: fresh flowers can carry bacteria that increase the risk of infection in immunocompromised patients. The other interventions may be helpful, but are less critical for infection prevention. 100. A patient with breast cancer is experiencing severe pain and is prescribed opioids for pain management. Which of the following is the nurse's priority assessment? A. Assess the patient's pain level and effectiveness of the medication. B. Monitor the patient's respiratory rate and oxygen saturation. C. Assess the patient's nutritional intake. D. Assess the patient's emotional well-being. Answer: B. Monitor the patient's respiratory rate and oxygen saturation. Rationale: opioids can depress the respiratory system, so monitoring the patient's respiratory rate and oxygen saturation is the priority to ensure safety. Other assessments are also important, but not the first priority. 101. A nurse is caring for a patient with cervical cancer who is receiving radiation therapy. Which of the following is the priority nursing intervention? A. Teach the patient how to manage skin reactions from radiation. B. Encourage the patient to avoid sexual intercourse during treatment. C. Monitor for signs of urinary retention. D. Educate the patient about chemotherapy side effects. Answer: A. Teach the patient how to manage skin reactions from radiation. Rationale: radiation therapy can cause skin reactions such as redness or irritation, which need to be managed to prevent infection. Educating the patient about skin care is a priority. 102. A nurse is caring for a patient receiving chemotherapy for ovarian cancer. The patient complains of nausea and vomiting. What is the nurse's priority intervention? A. Administer prescribed antiemetics. B. Encourage the patient to eat small, frequent meals. C. Offer ginger tea to relieve nausea. D. Provide the patient with ice chips to reduce nausea. Answer: A. Administer prescribed antiemetics. Rationale: the priority intervention for chemotherapy-induced nausea and vomiting is to administer antiemetic medications as prescribed. Other options can be helpful adjuncts, but antiemetics are the primary treatment. 103. A nurse is assessing a patient with a history of lung cancer who is experiencing new-onset dyspnea. Which of the following should be the nurse's priority action? A. Administer supplemental oxygen as prescribed. B. Assess the patient's vital signs and oxygen saturation. C. Prepare the patient for a chest X-ray. D. Encourage the patient to cough and deep breathe. Answer: B. Assess the patient's vital signs and oxygen saturation. Rationale: dyspnea can be a sign of a serious complication in lung cancer. The nurse should assess the patient's vital signs and oxygen saturation first to determine the severity of the issue before administering oxygen. 104. A nurse is caring for a patient receiving chemotherapy who has developed neutropenia. Which of the following should the nurse include in the care plan? A. Encourage frequent hand-washing by the patient. B. Place the patient on a high-fiber diet. C. Avoid use of prophylactic antibiotics. D. Limit visitors to those with active infections. Answer: A. Encourage frequent hand-washing by the patient. Rationale: hand-washing is crucial to prevent infection in patients with neutropenia. Other measures may also be necessary, but frequent hand-washing is the most effective prevention. 105. A nurse is caring for a patient with leukemia who is receiving chemotherapy. The patient is at risk for bleeding. Which of the following should be included in the nursing care plan? A. Monitor the platelet count closely. B. Apply a warm compress to areas of ecchymosis. C. Encourage high-impact exercise. D. Administer aspirin for pain relief. Answer: A. Monitor the platelet count closely. Rationale: patients with leukemia are at risk for thrombocytopenia, which can lead to bleeding. Monitoring platelet levels is essential to detect any signs of bleeding early. Other interventions are secondary to this. 106. A nurse is teaching a patient who has been diagnosed with breast cancer about chemotherapy. Which of the following should the nurse include in the teaching plan? A. You may experience hair loss, but it will grow back after treatment. B. Chemotherapy will cure your cancer completely. C. You should avoid drinking fluids during treatment. D. Expect your appetite to increase significantly. Answer: A. You may experience hair loss, but it will grow back after treatment. Rationale: hair loss is a common side effect of chemotherapy, but it generally grows back after treatment ends. Chemotherapy does not always cure cancer, and increased appetite is not a common side effect. 107. A patient with advanced cancer is being transitioned to palliative care. Which of the following interventions is most appropriate at this stage? A. Start chemotherapy to reduce tumor size. B. Provide aggressive pain management. C. Offer the patient an experimental treatment option. D. Focus on curative treatments. Answer: B. Provide aggressive pain management. Rationale: the goal of palliative care is symptom management, including pain control, to improve the patient's quality of life. Curative treatments are not appropriate at this stage. 108. A nurse is caring for a patient undergoing chemotherapy for colon cancer. The patient reports a sore throat and difficulty swallowing. What is the nurse's priority action? A. Administer pain medication as prescribed. B. Assess the oral cavity for signs of mucositis. C. Encourage the patient to drink warm tea. D. Instruct the patient to avoid talking. Answer: B. Assess the oral cavity for signs of mucositis. Rationale: mucositis is a common side effect of chemotherapy and can cause pain and difficulty swallowing. The nurse should assess the oral cavity for sores or other signs of mucosal damage. 109. A nurse is caring for a patient with cancer who is experiencing fatigue. Which of the following is the most important nursing intervention? A. Encourage the patient to rest frequently. B. Increase the patient's caloric intake. C. Administer a blood transfusion. D. Monitor the patient's hemoglobin levels. Answer: A. Encourage the patient to rest frequently. Rationale: fatigue is a common side effect of cancer and its treatments. Resting is essential to conserve energy and alleviate fatigue. Monitoring hemoglobin and increasing caloric intake may also be important, but not the priority. 110. A nurse is caring for a patient who is receiving radiation therapy for lung cancer. The patient reports feeling fatigued and short of breath. What should the nurse assess first? A. Oxygen saturation level. B. Presence of a cough. C. Skin changes in the radiation field. D. Vital signs and respiratory rate. Answer: A. Oxygen saturation level. Rationale: the nurse should assess oxygen saturation first in a patient with shortness of breath to determine if hypoxia is present, which can lead to further complications. Other assessments follow if necessary. 111. A nurse is caring for a patient with colorectal cancer who has a colostomy. Which of the following is most important to assess during the first 24 hours after surgery? A. The appearance of the stoma. B. The patient's ability to ambulate. C. The patient's level of pain. D. The patient's nutritional intake. Answer: A. The appearance of the stoma. Rationale: the nurse should assess the appearance of the stoma for signs of ischemia or necrosis in the first 24 hours after surgery. Pain management and nutrition are important but secondary at this time. 112. A nurse is caring for a patient with lung cancer who is receiving palliative care. Which of the following interventions is most appropriate for managing dyspnea? A. Administer prescribed opioids for pain relief. B. Encourage deep breathing exercises. C. Provide supplemental oxygen as ordered. D. Position the patient flat to reduce dyspnea. Answer: C. Provide supplemental oxygen as ordered. Rationale: oxygen therapy is a common intervention to manage dyspnea in palliative care patients. Administering opioids may also help, but oxygen is the primary intervention for managing respiratory distress. 113. A patient with cancer is receiving chemotherapy and is at risk for nausea and vomiting. Which of the following is the best preventative measure? A. Encourage the patient to eat a large meal before chemotherapy. B. Administer antiemetic medications as prescribed before treatment. C. Have the patient drink ginger tea prior to chemotherapy. D. Encourage the patient to fast before treatment. Answer: B. Administer antiemetic medications as prescribed before treatment. Rationale: administering antiemetic medications before chemotherapy is the most effective way to prevent nausea and vomiting. Other measures can be adjuncts, but are less effective as primary interventions. 114. A nurse is caring for a patient receiving chemotherapy who reports a metallic taste in the mouth. Which of the following should the nurse recommend? A. Avoid drinking water during meals. B. Use a saltwater rinse before meals. C. Increase the intake of acidic foods. D. Eat a high-protein diet. Answer: B. Use a saltwater rinse before meals. Rationale: a metallic taste is a common side effect of chemotherapy. A saltwater rinse can help neutralize the taste and improve comfort during meals. Other recommendations are less effective for this issue. 115. A nurse is caring for a patient who is undergoing chemotherapy and has developed alopecia. Which of the following interventions should the nurse include in the care plan? A. Encourage the patient to wear a wig or a scarf. B. Administer a scalp massage to stimulate hair growth. C. Suggest the patient avoid wearing hats. D. Provide information on hair replacement therapies. Answer: A. Encourage the patient to wear a wig or a scarf. Rationale: hair loss, alopecia, is a common side effect of chemotherapy, and offering wigs or scarves can help the patient cope with the aesthetic changes. Scalp massages and hair replacement therapies are less practical interventions. 116. A nurse is providing care for a patient receiving chemotherapy for lung cancer. Which of the following side effects should the nurse anticipate? A. Increased white blood cell count. B. Sensitivity to light. C. Decreased platelet count. D. Increased appetite. Answer: C. Decreased platelet count. Rationale: chemotherapy often causes myelosuppression, leading to a decreased platelet count, which increases the risk for bleeding. Increased appetite is not a typical chemotherapy side effect. 117. A nurse is caring for a patient with cancer who is receiving opioids for pain management. Which of the following interventions should be included in the care plan? A. Administer opioids on a fixed schedule to prevent pain. B. Encourage the patient to limit fluid intake. C. Monitor the patient for signs of addiction. D. Avoid offering pain medications if the patient requests them. Answer: A. Administer opioids on a fixed schedule to prevent pain. Rationale: administering opioids on a fixed schedule helps manage cancer pain effectively and prevents it from becoming severe. Monitoring for addiction is important but secondary. 118. A nurse is caring for a patient with breast cancer who has undergone a mastectomy. Which of the following interventions should the nurse include in the care plan for post-operative care? A. Elevate the affected arm to prevent lymphedema. B. Encourage the patient to perform arm exercises immediately. C. Avoid any exercise on the affected side for several weeks. D. Apply heat to the affected area to reduce swelling. Answer: A. Elevate the affected arm to prevent lymphedema. Rationale: elevating the affected arm helps prevent lymphedema after mastectomy. Arm exercises are important, but should be initiated after the initial recovery phase. Heat should not be applied to the affected area in the acute phase. 119. A nurse is caring for a patient receiving radiation therapy for prostate cancer. The nurse should monitor for which of the following side effects? A. Thrombocytopenia. B. Diarrhea. C. Hypertension. D. Alopecia. Answer: B. Diarrhea. Rationale: radiation therapy, particularly for prostate cancer, can cause gastrointestinal side effects, including diarrhea. Thrombocytopenia and alopecia are more common with chemotherapy. 120. A patient is receiving radiation therapy for brain cancer. Which of the following is the most important nursing intervention? A. Monitor the patient for signs of increased intracranial pressure. B. Encourage the patient to remain in bed during treatment. C. Administer antiemetics before treatment. D. Offer the patient a high-calorie diet. Answer. A. Monitor the patient for signs of increased intracranial pressure. Rationale. Brain radiation can lead to complications such as increased intracranial pressure. Monitoring for signs of increased ICP is crucial. Other interventions support overall care, but are secondary to this. 121. A nurse is caring for a patient with lung cancer who is receiving chemotherapy. What is the most important nursing action to manage the patient's risk for infection? A. Monitor for signs of infection. B. Administer antibiotics prophylactically. C. Encourage the patient to ambulate frequently. D. Provide a high-protein diet. Answer. A. Monitor for signs of infection. Rationale. Patients undergoing chemotherapy have suppressed immune systems, making them more vulnerable to infections. Monitoring for signs of infection is critical for early intervention. Antibiotics may be given as needed, but preventive antibiotics are not routinely administered. Ambulation and diet are supportive, but do not address the immediate infection risk. 122. A nurse is providing care to a patient who has undergone a radical prostatectomy. What should the nurse prioritize in postoperative care? A. Monitor for signs of infection. B. Encourage the patient to drink large amounts of fluids. C. Teach the patient how to perform Kegel exercises. D. Apply ice to the surgical site. Answer. A. Monitor for signs of infection. Rationale. After a prostatectomy, infection is a significant concern. Monitoring for signs of infection such as fever, redness, and drainage is a priority. Fluid intake is important, but infection risk takes precedence. Kegel exercises can be taught later in recovery, and ice may be used, but infection monitoring is the most urgent. 123. A nurse is caring for a patient who is receiving chemotherapy for leukemia. Which of the following interventions should be included to reduce the risk of bleeding? A. Encourage deep breathing exercises. B. Administer platelet transfusions as prescribed. C. Offer high-fiber foods to prevent constipation. D. Teach the patient to avoid physical activity. Answer. B. Administer platelet transfusions as prescribed. Rationale. Chemotherapy can cause thrombocytopenia, low platelet count, increasing the risk of bleeding. Administering platelet transfusions is the most direct intervention to manage this risk. Deep breathing, high-fiber foods, and avoiding physical activity may help overall wellness, but are not direct interventions for bleeding risk. 124. A nurse is providing care for a patient receiving radiation therapy for esophageal cancer. What is the most important nursing intervention? A. Monitor for esophagitis. B. Encourage frequent oral hygiene. C. Ensure the patient receives a high-protein diet. D. Administer antiemetics regularly. Answer. A. Monitor for esophagitis. Rationale. Radiation therapy to the esophagus can lead to esophagitis, causing pain and difficulty swallowing. Monitoring for this complication and intervening early, such as with pain management, is a priority. While good oral hygiene, a high-protein diet, and antiemetics are also important, they are not as critical as addressing esophagitis. 125. A nurse is caring for a patient receiving chemotherapy for ovarian cancer. Which of the following interventions should be prioritized to manage the patient's risk of neutropenia? A. Administer colony-stimulating factors as prescribed. B. Encourage hand-washing and hygiene. C. Provide a low-fat, low-sugar diet. D. Monitor for signs of fluid overload. Answer. A. Administer colony-stimulating factors as prescribed. Rationale. Neutropenia is a common side effect of chemotherapy, which can increase the risk of infection. Colony-stimulating factors help stimulate the production of neutrophils, a type of white blood cell, reducing the risk of infection. Hand washing and hygiene are also important, but secondary to the administration of medications to boost neutrophil count. Diet and monitoring for fluid overload are not directly related to managing neutropenia. 126. A nurse is caring for a patient who has undergone a colon resection for cancer. The patient is experiencing signs of dehydration. What is the most appropriate nursing intervention? A. Administer intravenous fluids as prescribed. B. Offer electrolyte-rich fluids. C. Encourage high-fiber foods. D. Initiate nasogastric tube feeding. Answer: A. Administer intravenous fluids as prescribed. Rationale: dehydration after surgery is a critical concern. Administering intravenous fluids is the quickest and most effective way to rehydrate the patient. Electrolyte-rich fluids and nasogastric tube feeding are supportive, but not as immediate as for fluids. High-fiber foods may be helpful later in recovery, but are not suitable for a patient who is dehydrated. 127. A nurse is caring for a patient with a history of breast cancer who is receiving tamoxifen therapy. What side effects should the nurse monitor for? A. Hot flashes. B. Weight loss. C. Constipation. D. Decreased appetite. Answer: A. Hot flashes. Rationale: tamoxifen, a selective estrogen receptor modulator used in breast cancer treatment, commonly causes hot flashes. While weight loss, constipation, and decreased appetite can occur, hot flashes are the most common side effect of tamoxifen therapy. 128. A nurse is caring for a patient with pancreatic cancer who is experiencing nausea and vomiting due to chemotherapy. What is the most important intervention? A. Administer antiemetic medications as prescribed. B. Encourage the patient to drink ginger tea. C. Monitor the patient for dehydration. D. Offer small, frequent meals. Answer: A. Administer antiemetic medications as prescribed. Rationale: chemotherapy-induced nausea and vomiting can be severe, and administering antiemetics as prescribed is the most effective way to control this symptom. Ginger tea, hydration, and small meals may help, but they are secondary to pharmaceutical management of nausea. 129. A nurse is caring for a patient with cancer who is experiencing extreme fatigue. Which of the following actions should the nurse prioritize? A. Encourage a daily exercise routine. B. Provide frequent rest periods. C. Offer a high-protein diet. D. Increase the patient's fluid intake. Answer: B. Provide frequent rest periods. Rationale: fatigue is a common symptom of cancer and its treatments. Frequent rest periods help conserve energy and reduce exhaustion. While exercise and diet are important, they should be tailored to the patient's energy level. Increased fluid intake is also helpful, but secondary to managing fatigue. 130. A nurse is caring for a patient undergoing chemotherapy for breast cancer. The nurse observes that the patient has developed mouth sores. Which intervention should the nurse implement? A. Recommend a soft, bland diet. B. Instruct the patient to gargle with mouthwash containing alcohol. C. Advise the patient to brush their teeth aggressively. D. Encourage the patient to stop chemotherapy. Answer: A. Recommend a soft, bland diet. Rationale: mouth sores, mucositis, are a common side effect of chemotherapy. A soft, bland diet will reduce irritation. Alcohol-based mouthwashes and aggressive brushing can worsen the sores. Stopping chemotherapy may not be appropriate unless advised by the oncologist. 131. A nurse is teaching a patient about radiation therapy for cervical cancer. Which statement indicates that the patient understands the teaching? A. I will need to avoid all foods during treatment. B. I can expect my skin to become irritated in the treated area. C. Radiation therapy will make me feel better right away. D. I will need to stay in the hospital during treatment. Answer: B. I can expect my skin to become irritated in the treated area. Rationale: skin irritation is a common side effect of radiation therapy. It is important for the patient to be informed about this and how to manage it. Avoiding all foods and expecting immediate relief are not typical expectations. Hospitalization is not usually required for radiation therapy. 132. A nurse is caring for a patient with lung cancer who is receiving chemotherapy. The nurse notices that the patient is experiencing shortness of breath and a cough. What should the nurse do first? A. Administer oxygen as prescribed. B. Increase the rate of the four fluids. C. Check the patient's blood pressure. D. Notify the healthcare provider. Answer. A. Administer oxygen as prescribed. Rationale. Shortness of breath and cough could indicate respiratory distress, and administering oxygen helps alleviate symptoms while further assessment is done. The other interventions are less immediate in addressing the patient's respiratory needs. 133. A patient with colorectal cancer is receiving chemotherapy and reports experiencing nausea and vomiting. Which of the following is the most appropriate intervention to manage these symptoms? A. Administer antiemetic medications as prescribed. B. Increase the patient's fluid intake. C. Offer the patient small, frequent meals. D. Encourage the patient to rest in a sitting position. Answer. A. Administer antiemetic medications as prescribed. Rationale. Antiemetics are the most effective way to control chemotherapy-induced nausea and vomiting. Increasing fluid intake and offering small meals can help but are secondary to pharmacological intervention. Resting in a sitting position may be helpful for comfort, but does not address the underlying issue. 134. A nurse is caring for a patient with metastatic cancer who is receiving opioid pain medication. Which of the following interventions should be included in the care plan? A. Administer opioids on a fixed schedule. B. Limit the patient's fluid intake. C. Monitor the patient's blood sugar levels. D. Avoid offering pain medications if the patient requests them. Answer. A. Administer opioids on a fixed schedule. Rationale. Pain management should be proactive, especially in cancer patients, to prevent pain from becoming severe. Administering opioids on a fixed schedule ensures effective pain control. Monitoring blood sugar levels is not typically necessary unless the patient has diabetes. Limiting fluids or avoiding pain medications are not appropriate in this case. 135. A nurse is providing education to a patient about the side effects of chemotherapy. Which of the following should the nurse include in the teaching? A. You may experience hair loss. B. Chemotherapy will improve your skin condition. C. Chemotherapy will not affect your appetite. D. You will not feel tired during chemotherapy. Answer. A. You may experience hair loss. Rationale. Hair loss is a common side effect of chemotherapy. Educating the patient about potential side effects such as hair loss prepares them for the changes they may experience. Chemotherapy typically causes fatigue, loss of appetite, and other side effects, not improvements in skin or energy. 136. A nurse is caring for a patient who is receiving radiation therapy for head and neck cancer. What is the most important nursing intervention? A. Provide oral care before and after treatments. B. Encourage the patient to chew gum frequently. C. Offer ice chips to soothe the mouth. D. Apply moisturizing lotion to the skin. Answer. A. Provide oral care before and after treatments. Rationale. Radiation therapy to the head and neck can cause mouth dryness, sores, and mucositis. Good oral hygiene is essential to minimize these effects and promote healing. Chewing gum and ice chips may help but are secondary to proper oral care. Moisturizing lotion is important for skin care but does not address the oral side effects directly. 137. A nurse is caring for a patient receiving chemotherapy for cancer. The patient is at risk for neutropenia. Which of the following is a priority intervention? A. Instruct the patient to avoid crowded places. B. Provide a high-protein, high-calorie diet. C. Encourage fluid intake. D. Administer prescribed antibiotics. Answer. A. Instruct the patient to avoid crowded places. Rationale. Neutropenia increases the risk of infection, and avoiding crowded places helps reduce the likelihood of exposure to infectious agents. A high-protein diet supports healing, but is secondary to infection prevention. Fluid intake and antibiotics may also be part of the care plan, but are not as immediate in preventing infection. 138. A nurse is caring for a patient receiving chemotherapy for lung cancer. The patient is experiencing nausea and vomiting. Which intervention should the nurse prioritize? A. Administer antiemetics as prescribed. B. Provide a high-calorie diet. C. Offer fluids with a high sugar content. D. Encourage the patient to rest in bed. Answer: A. Administer antiemetics as prescribed. Rationale: antiemetics are the most effective way to manage chemotherapy-induced nausea and vomiting. Offering fluids with sugar or a high-calorie diet may help later, but are secondary to managing the nausea. Resting in bed may offer comfort, but does not address the root cause of nausea. 139. A nurse is caring for a patient with ovarian cancer who is receiving chemotherapy. Which of the following side effects should the nurse monitor for? A. Hair loss. B. Excessive weight gain. C. Decreased heart rate. D. Increased appetite. Answer: A. Hair loss. Rationale: hair loss is a common side effect of chemotherapy. Monitoring for hair loss and providing support to manage it is important. Weight gain, decreased heart rate, and increased appetite are not typically related to chemotherapy for ovarian cancer. 140. A nurse is caring for a patient receiving radiation therapy for rectal cancer. What is the most important nursing action to minimize skin irritation from radiation? A. Apply moisturizing lotion to the skin. B. Cleanse the skin with soap and water. C. Avoid applying any products to the skin. D. Apply ice packs to the treated area. Answer: A. Apply moisturizing lotion to the skin. Rationale: radiation therapy can cause skin irritation. Applying moisturizing lotion helps soothe and protect the skin. Soap and water can be too harsh, and applying ice packs may cause additional irritation. Products should be used cautiously as directed by the healthcare provider. 141. A nurse is teaching a patient about cancer pain management. Which of the following statements by the patient indicates a need for further teaching? A. I should take my pain medications regularly to prevent pain. B. I can wait until the pain becomes severe before taking my pain medication. C. It is important to manage pain before it gets worse. D. Pain medications can be adjusted if I experience side effects. Answer: B. I can wait until the pain becomes severe before taking my pain medication. Rationale: pain management should be proactive to prevent pain from becoming severe. Waiting until the pain becomes severe may lead to poor pain control. Regular use of pain medications helps maintain consistent relief. Adjustments for side effects can be made, but waiting for severe pain is not an optimal strategy. 142. A nurse is caring for a patient with advanced cancer who is in the terminal stage. Which of the following should the nurse focus on in the care plan? A. Managing pain and providing comfort. B. Encouraging aggressive treatment to prolong life. C. Monitoring lab values for improvement. D. Offering nutritional supplements to increase weight. Answer: A. Managing pain and providing comfort. Rationale: in the terminal stage, the focus should be on comfort and quality of life, with pain management as a priority. Aggressive treatments and monitoring lab values are not typically helpful at this stage. Nutritional supplements are secondary to providing comfort. 143. A nurse is caring for a patient receiving chemotherapy for breast cancer. The patient reports feeling fatigued and weak. Which of the following should the nurse do first? A. Encourage frequent rest periods. B. Increase the patient's protein intake. C. Administer a dose of pain medication. D. Recommend an exercise regimen. Answer: A. Encourage frequent rest periods. Rationale: fatigue is a common side effect of chemotherapy. Encouraging rest is the first step in helping the patient manage the symptom. The other interventions may be helpful, but are secondary to addressing the immediate need for rest. 144. A nurse is caring for a patient with leukemia who is receiving chemotherapy. The patient is at high risk for infection. Which of the following actions should the nurse take to prevent infection? A. Ensure that the patient is in a private room. B. Administer immunizations as prescribed. C. Allow the patient to have visitors freely. D. Monitor the patient's blood pressure regularly. Answer: A. Ensure that the patient is in a private room. Rationale: a private room helps prevent exposure to infections from other patients. Immunizations should be up to date, but are not a priority while the patient is undergoing chemotherapy. Visitors should be limited to reduce the risk of infection. Monitoring blood pressure is important, but does not directly address infection prevention. 145. A nurse is caring for a patient with cancer who is experiencing extreme pain. The nurse is preparing to administer an opioid analgesic. Which of the following should the nurse assess before administration? A. Pain intensity and level of sedation. B. The patient's blood glucose level. C. The patient's temperature. D. The patient's mobility status. Answer: A. Pain intensity and level of sedation. Rationale: before administering an opioid analgesic, it is essential to assess pain intensity and the patient's level of sedation to ensure appropriate dosing. The patient's blood glucose, temperature, and mobility are important, but are not the most immediate concerns when managing pain. 146. A nurse is caring for a patient with terminal cancer. The patient asks about the expected outcome of treatment. Which response by the nurse is most appropriate? A. You will likely live for several more years. B. We are focusing on managing symptoms and improving quality of life. C. We will cure your cancer through treatment. D. You will need to decide if you want to continue treatment or stop. Answer: B. We are focusing on managing symptoms and improving quality of life. Rationale: in terminal cancer, the focus shifts to symptom management and comfort. Curing the cancer is not an expectation, and providing a clear and compassionate response is key to the patient's emotional well-being. 147. A nurse is providing care for a patient receiving radiation therapy for head and neck cancer. The patient complains of dry mouth and difficulty swallowing. Which of the following interventions should the nurse prioritize? A. Administer prescribed mouthwash. B. Increase fluid intake. C. Provide soft, moist foods. D. Encourage frequent oral care. Answer: C. Provide soft, moist foods. Rationale: dry mouth, xerostomia, and difficulty swallowing, dysphagia, are common side effects of head and neck radiation therapy. Offering soft, moist foods makes swallowing easier and helps with comfort. While mouthwash, fluid intake, and oral care are important, they are secondary to improving the patient's ability to eat. 148. A nurse is teaching a patient with colorectal cancer about managing chemotherapy side effects. Which of the following should the nurse emphasize to reduce the risk of infection? A. Avoid large crowds and people with infections. B. Use a soft toothbrush to prevent gum injury. C. Wash hands frequently and avoid touching the face. D. Ensure adequate hydration and a high-fiber diet. Answer: C. Wash hands frequently and avoid touching the face. Rationale: chemotherapy can weaken the immune system, increasing the risk of infection. Hand hygiene is the most effective way to prevent infections. Avoiding large crowds and using a soft toothbrush are also important, but do not directly address the prevention of infection as effectively as hand hygiene. 149. A nurse is caring for a patient with prostate cancer who is receiving hormone therapy. The patient reports hot flashes and mood swings. Which of the following is the most appropriate nursing intervention? A. Administer a medication to treat depression. B. Provide a fan or cool cloth to manage hot flashes. C. Suggest exercise as a way to manage mood swings. D. Encourage the patient to take antidepressants as prescribed. Answer: B. Provide a fan or cool cloth to manage hot flashes. Rationale: hot flashes are a common side effect of hormone therapy for prostate cancer. Providing cooling measures such as a fan or cool cloth can help alleviate discomfort. While exercise and antidepressants may be helpful for mood swings, addressing hot flashes takes priority. 150. A nurse is teaching a patient with lung cancer about the side effects of chemotherapy. Which of the following should the nurse include in the teaching plan regarding the prevention of mucositis? A. Rinse the mouth with alcohol-based mouthwash. B. Brush teeth vigorously to remove food particles. C. Use a soft toothbrush and rinse with a saline solution. D. Avoid drinking fluids to reduce irritation. Answer: C. Use a soft toothbrush and rinse with a saline solution. Rationale: mucositis is a common side effect of chemotherapy, and gentle oral care is essential. A soft toothbrush and saline mouth rinse can help prevent irritation and promote oral comfort. Alcohol-based mouthwash should be avoided, as it can further irritate the mucosa. 151. A nurse is caring for a patient receiving chemotherapy for ovarian cancer. The patient is at risk for neutropenia. Which of the following precautions should the nurse implement to protect the patient from infection? A. Place the patient in a private room with reverse isolation. B. Restrict all visitors from the patient's room. C. Ensure that the patient receives a flu vaccine. D. Administer prophylactic antibiotics. Answer: A. Place the patient in a private room with reverse isolation. Rationale: neutropenia increases the risk of infection, so placing the patient in a private room with reverse isolation is essential to minimize exposure to pathogens. Visitors should be limited, but complete restriction is unnecessary. Prophylactic antibiotics are used selectively. 152. A nurse is providing care for a patient with metastatic breast cancer who is receiving chemotherapy. The patient reports nausea and vomiting. Which of the following actions should the nurse take first? A. Administer an antiemetic as prescribed. B. Assess the patient's hydration status. C. Offer small, frequent meals. D. Provide a cool cloth to reduce discomfort. Answer: A. Administer an antiemetic as prescribed. Rationale: nausea and vomiting are common side effects of chemotherapy. Administering an antiemetic as prescribed is the first step in managing these symptoms. The other interventions can be implemented after the immediate symptom relief is addressed. 153. A nurse is caring for a patient who is receiving radiation therapy for lung cancer. The patient asks about potential long-term side effects. Which of the following is a potential long-term effect of radiation therapy for lung cancer? A. Cataracts. B. Osteoporosis. C. Respiratory complications. D. Hearing loss. Answer: C. Respiratory complications. Rationale: respiratory complications, such as fibrosis, are common long-term effects of radiation therapy for lung cancer. Cataracts, osteoporosis, and hearing loss are potential side effects of other treatments, but are not as closely associated with radiation therapy for lung cancer. 154. A nurse is caring for a patient receiving chemotherapy who has developed thrombocytopenia. The nurse should instruct the patient to avoid which of the following activities? A. Walking and light exercise. B. Taking hot baths. C. Using a razor to shave. D. Eating a high-protein diet. Answer: C. Using a razor to shave. Rationale: thrombocytopenia increases the risk of bleeding, so using a razor to shave should be avoided to prevent cuts and bleeding. Walking and light exercise are generally safe unless contraindicated by the patient's condition. Taking hot baths does not directly relate to the risk of bleeding. 155. A nurse is educating a patient with breast cancer who is about to start chemotherapy. The nurse should teach the patient to report which of the following immediately? A. New or unusual headache. B. Pain or tenderness in the mouth. C. Increased appetite and weight gain. D. Mild joint pain. Answer: B. Pain or tenderness in the mouth. Rationale: chemotherapy can cause mucositis and increase the risk of infection in the mouth. Pain or tenderness in the mouth should be reported immediately to prevent complications. Headaches, appetite changes, and joint pain should also be monitored, but are less urgent. 156. A nurse is caring for a patient who is receiving radiation therapy for thyroid cancer. The patient is experiencing severe fatigue. Which of the following should the nurse recommend to the patient to manage this symptom? A. Engage in mild physical activity, such as walking. B. Increase intake of caffeine to boost energy levels. C. Take long naps during the day to rest. D. Reduce fluid intake to avoid the need for frequent bathroom trips. Answer: A. Engage in mild physical activity, such as walking. Rationale: Mild physical activity can help combat fatigue and improve overall energy levels in patients receiving radiation therapy. Caffeine can disrupt sleep and is not recommended. Napping can help, but it should not interfere with regular sleep patterns. Fluid restriction is not appropriate unless medically indicated. 157. A nurse is caring for a patient who is receiving chemotherapy for colon cancer. The patient reports feeling lightheaded and dizzy. Which of the following is the nurse's priority action? A. Administer an antiemetic. B. Monitor the patient's blood pressure. C. Provide a calming environment. D. Encourage oral fluid intake. Answer: B. Monitor the patient's blood pressure. Rationale: lightheadedness and dizziness may indicate hypotension, which can be a side effect of chemotherapy or dehydration. Monitoring blood pressure is the priority action to assess and manage the symptom. The other actions may be appropriate later, but are not the immediate priority. 158. A nurse is caring for a patient with cervical cancer who is undergoing brachytherapy. The nurse should take which of the following precautions when caring for this patient? A. Wear a lead apron when providing direct patient care. B. Administer prescribed antiemetic medications before treatment. C. Limit the patient's fluid intake to prevent urinary retention. D. Maintain a sterile field when changing the dressing. Answer: A. Wear a lead apron when providing direct patient care. Rationale: brachytherapy involves the placement of radioactive material inside the body, and the nurse should wear a lead apron to reduce exposure to radiation. Anti-nausea medication may be given before treatment, but it is not the main safety concern. Fluid intake should be encouraged unless contraindicated. 159. A nurse is caring for a patient with advanced cancer who is receiving palliative care. The nurse should prioritize which of the following interventions? A. Administering antibiotics to prevent infection. B. Controlling the patient's pain and symptoms. C. Encouraging the patient to eat a well-balanced diet. D. Providing curative treatments. Answer: B. Controlling the patient's pain and symptoms. Rationale: in palliative care, the primary focus is on providing relief from pain and symptoms to improve quality of life. Antibiotics and a well-balanced diet are important, but are not the priority at this stage. Curative treatments are not part of palliative care. 160. A nurse is providing care for a patient with end-stage cancer who is experiencing shortness of breath. The nurse should take which of the following actions first? A. Administer an opioid analgesic as prescribed. B. Place the patient in an upright position to ease breathing. C. Increase the oxygen flow rate as prescribed. D. Provide a calming environment to reduce anxiety. Answer: B. Place the patient in an upright position to ease breathing. Rationale: placing the patient in an upright position is the first intervention to help alleviate shortness of breath. Oxygen, analgesics, and a calming environment may also be beneficial, but are secondary to improving the patient's ability to breathe. 161. A nurse is caring for a patient with leukemia who is receiving chemotherapy. The patient reports feeling feverish and chills. Which of the following should the nurse do first? A. Administer antipyretic medication as prescribed. B. Obtain blood cultures and notify the healthcare provider. C. Increase the patient's fluid intake. D. Apply a cool compress to reduce the fever. Answer: B. Obtain blood cultures and notify the healthcare provider. Rationale: fever and chills in a patient receiving chemotherapy may indicate an infection. Obtaining blood cultures and notifying the healthcare provider should be done first to identify the cause of the fever and guide treatment. Antipyretics and fluid intake can be addressed later after the infection is managed. 162. A nurse is teaching a patient with lung cancer about the side effects of chemotherapy. Which of the following should the nurse emphasize to the patient to prevent skin breakdown? A. Apply moisturizing lotion to the skin regularly. B. Wear tight-fitting clothing to reduce skin irritation. C. Avoid using sunscreen when going outside. D. Take hot showers to cleanse the skin. Answer: A. Apply moisturizing lotion to the skin regularly. Rationale: chemotherapy can cause skin dryness and irritation. Regular use of moisturizing lotion helps to prevent skin breakdown. Tight-fitting clothing and hot showers should be avoided, as they can exacerbate irritation. Sunscreen should be used to protect the skin from further damage. 163. A nurse is caring for a patient with cancer who is receiving radiation therapy. The nurse should instruct the patient to avoid which of the following activities? A. Eating a balanced diet to maintain strength. B. Applying pressure to the irradiated area. C. Drinking fluids to stay hydrated. D. Performing light exercises to improve circulation. Answer. B. Applying pressure to the irradiated area. Rationale. Applying pressure to the irradiated area can cause tissue damage and increase the risk of skin breakdown. While eating a balanced diet, drinking fluids, and performing light exercises are important, avoiding pressure to the irradiated area is the priority. 164. A nurse is caring for a patient receiving chemotherapy who develops a low white blood cell count. The nurse should monitor for which of the following complications? A. Infection. B. Dehydration. C. Hyperglycemia. D. Hypokalemia. Answer. A. Infection. Rationale. A low white blood cell count, neutropenia, increases the risk of infection. The nurse should monitor the patient for signs of infection, such as fever, chills, and redness or warmth at the site of an incision. Dehydration, hyperglycemia, and hypokalemia are not directly related to a low white blood cell count. 165. A nurse is caring for a patient receiving chemotherapy for breast cancer. The patient complains of hair loss. Which of the following interventions should the nurse include in the care plan? A. Reassure the patient that hair loss is temporary and will regrow after treatment. B. Encourage the patient to wear a wig or a scarf to maintain self-esteem. C. Suggest the patient avoid washing their hair to prevent further hair loss. D. Advise the patient to use a hot comb to style their hair. Answer. B. Encourage the patient to wear a wig or scarf to maintain self-esteem. Rationale. Hair loss, alopecia, is a common side effect of chemotherapy, and encouraging the patient to wear a wig or scarf can help maintain self-esteem and body image. Reassurance is important, but the primary goal is to support the patient's emotional well-being. Avoiding washing the hair or using hot styling tools are not effective in managing hair loss. 166. A nurse is caring for a patient with advanced cancer who is experiencing pain. The nurse should administer which of the following medications first? A. Acetaminophen. B. Morphine. C. Nonsteroidal anti-inflammatory drug NSAID. D. Aspirin. Answer. B. Morphine. Rationale. Morphine is a potent opioid analgesic used to manage moderate to severe pain, especially in patients with advanced cancer. Acetaminophen and NSAIDs are used for mild to moderate pain, but are less effective for severe pain. Aspirin is not typically recommended for cancer pain management due to its anticoagulant properties. 167. A nurse is educating a patient with prostate cancer who is receiving androgen deprivation therapy. The nurse should instruct the patient to report which of the following symptoms? A. Increased appetite. B. Painful urination. C. Swelling of the ankles. D. Hot flashes. Answer. C. Swelling of the ankles. Rationale. Swelling of the ankles may indicate fluid retention, a potential side effect of androgen deprivation therapy. Hot flashes, painful urination, and increased appetite are also side effects, but are less urgent compared to fluid retention. 168. A nurse is caring for a patient with metastatic lung cancer who is receiving palliative care. Which of the following interventions should the nurse prioritize? A. Providing curative treatment options. B. Offering emotional support to the patient and family. C. Administering chemotherapy as prescribed. D. Encouraging the patient to continue working and being active. Answer. B. Offering emotional support to the patient and family. Rationale. In palliative care, the focus is on comfort, quality of life, and emotional support for the patient and family. Curative treatments and chemotherapy are not part of palliative care. Encouraging continued work and activity is not realistic given the patient's condition. 169. A nurse is caring for a patient with cancer who is experiencing nausea and vomiting due to chemotherapy. Which of the following interventions should the nurse implement first? A. Administer an antiemetic medication as prescribed. B. Provide the patient with a bland diet. C. Offer the patient small sips of water. D. Reassure the patient that nausea is a common side effect. Answer: A. Administer an antiemetic medication as prescribed. Rationale: nausea and vomiting are common side effects of chemotherapy. Administering an antiemetic as prescribed is the first step in managing these symptoms. Providing a bland diet and offering fluids can be done after the nausea is controlled. Reassurance is helpful, but not the priority action. 170. A nurse is caring for a patient with colon cancer who is scheduled for surgery. The patient expresses concerns about the postoperative care plan. Which of the following is the most appropriate response by the nurse? A. You will need to adjust to a permanent colostomy after surgery. B. The surgery should result in complete remission and no further treatments will be needed. C. We will discuss the postoperative plan with the surgical team before your surgery. D. Your main concern should be the risk of infection after the surgery. Answer: C. We will discuss the postoperative plan with the surgical team before your surgery. Rationale: it is important to provide the patient with accurate information about the surgery and postoperative care. Discussing the plan with the surgical team ensures the patient receives comprehensive and tailored care. Telling the patient they will need a permanent colostomy or that no further treatments will be needed may not be accurate. 171. A nurse is caring for a patient receiving chemotherapy who has developed a mouth ulcer. Which of the following interventions should the nurse recommend to manage this condition? A. Use an alcohol-based mouthwash to cleanse the mouth. B. Avoid spicy or acidic foods that may irritate the ulcer. C. Brush the teeth with a hard-bristled toothbrush to remove debris. D. Apply a warm compress to the affected area. Answer: B. Avoid spicy or acidic foods that may irritate the ulcer. Rationale: mouth ulcers are a common side effect of chemotherapy. Avoiding spicy or acidic foods can help prevent irritation and promote healing. Alcohol-based mouthwashes and hard-bristled toothbrushes should be avoided, as they can further irritate the mucosa. A warm compress is not an effective treatment for mouth ulcers. 172. A nurse is caring for a patient who is receiving radiation therapy for head and neck cancer. The patient complains of difficulty swallowing and dry mouth. Which of the following interventions should the nurse prioritize? A. Provide humidification to the room. B. Administer a prescription for saliva substitutes. C. Encourage the patient to drink fluids frequently. D. Offer the patient soft foods that are easy to swallow. Answer: D. Offer the patient soft foods that are easy to swallow. Rationale: difficulty swallowing and dry mouth are common side effects of radiation therapy for head and neck cancer. Offering soft foods helps make swallowing easier and reduces discomfort. Saliva substitutes and humidification may also be helpful, but providing easy-to-swallow foods is the priority. 173. A nurse is caring for a patient receiving chemotherapy for ovarian cancer. The patient reports experiencing fatigue. Which of the following interventions should the nurse recommend to the patient? A. Increase physical activity and exercise regularly. B. Take short naps throughout the day to conserve energy. C. Engage in strenuous activity to boost energy levels. D. Avoid consuming caffeine to reduce fatigue. Answer: B. Take short naps throughout the day to conserve energy. Rationale: fatigue is a common side effect of chemotherapy. Taking short naps helps the patient conserve energy and manage fatigue. Increasing physical activity may be helpful, but the patient should avoid strenuous activity. Caffeine can exacerbate fatigue and disrupt sleep patterns. 174. A nurse is caring for a patient with metastatic liver cancer. The patient is experiencing ascites. Which of the following is the priority nursing intervention? A. Administer diuretics as prescribed. B. Monitor the patient's weight and abdominal girth. C. Position the patient in a supine position. D. Encourage the patient to eat a low-sodium diet. Answer: B. Monitor the patient's weight and abdominal girth. Rationale: Monitoring weight and abdominal girth is essential in assessing the extent of ascites and evaluating the effectiveness of treatment. Administering diuretics and encouraging a low-sodium diet are important interventions, but should follow the monitoring of the patient's condition. The supine position is not recommended for patients with ascites due to the potential for respiratory difficulty. 175. A nurse is caring for a patient with breast cancer who is undergoing chemotherapy. The patient asks about the risk of infertility. Which of the following should the nurse explain to the patient? A. Chemotherapy is unlikely to affect fertility in women. B. Chemotherapy can cause infertility, but it may be temporary. C. Chemotherapy does not affect fertility in men or women. D. Fertility preservation options should be discussed before chemotherapy begins. Answer: D. Fertility preservation options should be discussed before chemotherapy begins. Rationale: chemotherapy can cause infertility, and the risk may be permanent or temporary. It is important to discuss fertility preservation options with the patient before starting chemotherapy. Fertility effects can vary by individual and treatment regimen. 176. A nurse is caring for a patient with cervical cancer who is receiving radiation therapy. The patient reports feeling anxious about the treatment. Which of the following should the nurse do first? A. Offer the patient information about the radiation therapy. B. Encourage the patient to talk about their concerns. C. Provide reassurance that the therapy will be successful. D. Advise the patient to take anti-anxiety medication. Answer: B. Encourage the patient to talk about their concerns. Rationale: the nurse should first provide an opportunity for the patient to express their concerns. This allows the nurse to address any misconceptions, provide support, and reduce anxiety. Offering information about the treatment and reassurance can follow once the patient has had a chance to express their feelings. 177. A nurse is caring for a patient with cancer who is receiving chemotherapy and develops a temperature of 101.5 degrees Fahrenheit 38.6 degrees Celsius. Which of the following actions should the nurse take first? A. Administer an antipyretic as prescribed. B. Notify the healthcare provider. C. Monitor the patient's blood pressure. D. Offer fluids to the patient. Answer: B. Notify the healthcare provider. Rationale: a fever in a patient receiving chemotherapy may indicate infection, which is a serious complication. The nurse should notify the healthcare provider immediately to assess the need for further interventions such as blood cultures, antibiotics, or other treatments. 178. A nurse is caring for a patient with a history of breast cancer who is receiving tamoxifen. Which of the following side effects should the nurse monitor for? A. Hot flashes. B. Diarrhea. C. Hair loss. D. Anemia. Answer: A. Hot flashes. Rationale: tamoxifen, an anti-estrogen medication used in breast cancer treatment, can cause hot flashes as a common side effect. Diarrhea, hair loss, and anemia are not typical side effects of tamoxifen. 179. A nurse is caring for a patient who has undergone a mastectomy for breast cancer. The nurse notices that the patient's arm on the affected side is swollen. Which of the following is the most likely cause? A. Lymphedema. B. Infection. C. Hematoma. D. DVT. Answer: A. Lymphedema. Rationale: lymphedema is a common complication following a mastectomy, especially when lymph nodes are removed. It causes swelling in the arm due to the disruption of normal lymphatic drainage. Infection, hematoma, and DVT are less likely causes. 180. A nurse is caring for a patient with colon cancer who is scheduled for a colostomy. Which of the following should the nurse include in the preoperative teaching? A. Avoid drinking liquids before surgery. B. Prepare for an extended hospital stay. C. Learn how to care for the colostomy postoperatively. D. Limit intake of high-fiber foods. Answer: C. Learn how to care for the colostomy postoperatively. Rationale: it is essential to teach the patient how to care for their colostomy to promote self-care and prevent complications. The patient should not avoid drinking liquids before surgery unless instructed to do so by the surgical team. An extended hospital stay is not always required, and high-fiber foods are typically limited postoperatively, not before. 181. A nurse is caring for a patient with ovarian cancer who is receiving chemotherapy. The patient reports feeling nauseated and unable to eat. Which of the following should the nurse do first? A. Administer antiemetic medication as prescribed. B. Offer the patient small, frequent meals. C. Encourage the patient to drink clear liquids. D. Offer the patient a cold compress for nausea relief. Answer. A. Administer antiemetic medication as prescribed. Rationale. Nausea and vomiting are common side effects of chemotherapy. Administering antiemetic medication is the first intervention to control these symptoms. Once nausea is controlled, offering small meals and clear liquids can help with nutrition and hydration. 182. A nurse is caring for a patient receiving chemotherapy who develops neutropenia. Which of the following interventions should the nurse implement? A. Encourage a high-protein diet. B. Maintain strict hand hygiene and infection precautions. C. Administer a blood transfusion. D. Offer fluids to promote kidney function. Answer. B. Maintain strict hand hygiene and infection precautions. Rationale. Neutropenia increases the risk of infection. The nurse should maintain strict hand hygiene and infection precautions to protect the patient from potential infections. Encouraging a high-protein diet and offering fluids are important, but the priority is infection prevention. 183. A nurse is caring for a patient with a diagnosis of leukemia. The patient is receiving chemotherapy and develops mucositis. Which of the following actions should the nurse take first? A. Offer the patient soft, bland foods. B. Administer a topical analgesic for pain relief. C. Ensure the patient receives adequate oral hygiene. D. Encourage the patient to drink fluids to prevent dehydration. Answer. C. Ensure the patient receives adequate oral hygiene. Rationale. Mucositis can cause oral discomfort and increase the risk of infection. Ensuring proper oral hygiene is the first step to prevent further complications. Afterward, the nurse can administer pain relief, encourage fluid intake, and offer soft foods. 184. A nurse is caring for a patient with lung cancer who is experiencing difficulty breathing. Which of the following interventions should the nurse implement first? A. Administer oxygen as prescribed. B. Provide a calm, quiet environment. C. Elevate the head of the bed. D. Encourage the patient to cough and deep breathe. Answer. A. Administer oxygen as prescribed. Rationale. Difficulty breathing may indicate inadequate oxygenation. Administering oxygen should be the first priority to improve oxygen levels. The other interventions can follow once oxygenation is addressed. 185. A nurse is caring for a patient with bladder cancer who is undergoing radiation therapy. Which of the following side effects should the nurse monitor for? A. Dysuria. B. Alopecia. C. Diarrhea. D. Weight gain. Answer. A. Dysuria. Rationale. Radiation therapy to the pelvic area, such as for bladder cancer, can cause dysuria, painful urination, due to irritation of the bladder. Alopecia, diarrhea, and weight gain are less commonly associated with pelvic radiation. 186. A nurse is caring for a patient who is receiving chemotherapy for lymphoma. The nurse should monitor the patient for which of the following complications? A. Thrombocytopenia. B. Hypercalcemia. C. Hypothyroidism. D. Hemochromatosis. Answer. A. Thrombocytopenia. Rationale. Chemotherapy can cause bone marrow suppression, leading to a decrease in platelet production, resulting in thrombocytopenia. Hypercalcemia, hypothyroidism, and hemochromatosis are not common complications of chemotherapy for lymphoma. 187. A nurse is caring for a patient with esophageal cancer who is receiving radiation therapy. The nurse should instruct the patient to avoid which of the following? A. Eating small, frequent meals. B. Drinking liquids through a straw. C. Eating spicy or acidic foods. D. Using a humidifier at night. Answer. C. Eating spicy or acidic foods. Rationale. Radiation therapy to the esophagus can cause irritation and inflammation, and eating spicy or acidic foods may worsen these symptoms. Eating small meals and drinking liquids through a straw can help manage symptoms. Using a humidifier at night can also be beneficial. 188. A nurse is caring for a patient with leukemia who is receiving chemotherapy and develops thrombocytopenia. Which of the following interventions should the nurse prioritize? A. Encourage the patient to ambulate to prevent clots. B. Monitor the patient for signs of bleeding. C. Administer a platelet transfusion. D. Administer an anticoagulant to prevent clots. Answer: B. Monitor the patient for signs of bleeding. Rationale: thrombocytopenia increases the risk of bleeding, so the nurse should prioritize monitoring the patient for signs of bleeding, such as petechiae, bruising, or nosebleeds. Platelet transfusions and anticoagulants may be indicated, but bleeding assessment is the priority. 189. A nurse is caring for a patient with cancer who is receiving chemotherapy and reports feeling constipated. Which of the following should the nurse recommend? A. Increase dietary fiber intake. B. Use a stool softener as prescribed. C. Decrease fluid intake. D. Avoid exercise and rest in bed. Answer: B. Use a stool softener as prescribed. Rationale: constipation is a common side effect of chemotherapy. A stool softener can help alleviate constipation by softening the stool and making bowel movements easier. Increasing dietary fiber and fluid intake may also be helpful, but should be done in conjunction with stool softeners. Exercise is encouraged to promote bowel movement. 190. A nurse is caring for a patient with prostate cancer who is receiving androgen deprivation therapy. Which of the following side effects should the nurse monitor for? A. Gynecomastia. B. Edema. C. Increased appetite. D. Increased energy. Answer: A. Gynecomastia. Rationale: androgen deprivation therapy reduces male hormone levels and can lead to the development of gynecomastia, enlarged breasts. Edema, increased appetite, and increased energy are not common side effects. 191. A nurse is caring for a patient receiving chemotherapy for colorectal cancer. The patient reports experiencing mouth sores. Which of the following interventions should the nurse recommend? A. Use an alcohol-based mouthwash. B. Eat hot, spicy foods to promote healing. C. Practice good oral hygiene with a soft toothbrush. D. Avoid drinking liquids to prevent further irritation. Answer: C. Practice good oral hygiene with a soft toothbrush. Rationale: mouth sores, mucositis, are a common side effect of chemotherapy. Practicing good oral hygiene with a soft toothbrush can help prevent infection and irritation. Alcohol-based mouthwashes and spicy foods should be avoided, as they can worsen symptoms. 192. A nurse is caring for a patient with cancer who is receiving opioid pain medication. The nurse should monitor for which of the following side effects? A. Tachycardia. B. Hypotension. C. Hyperthermia. D. Respiratory depression. Answer: D. Respiratory depression. Rationale: opioid pain medications can cause respiratory depression, which is a life-threatening side effect. The nurse should monitor the patient closely for signs of respiratory depression, such as slow or shallow breathing. 193. A nurse is caring for a patient with cancer who is receiving chemotherapy and develops nausea and vomiting. Which of the following is the most appropriate intervention to prevent further nausea? A. Administer an antiemetic before chemotherapy. B. Offer the patient ginger tea. C. Encourage the patient to lie flat after meals. D. Increase the patient's fluid intake. Answer: A. Administer an antiemetic before chemotherapy. Rationale: administering an antiemetic before chemotherapy helps prevent nausea and vomiting. Offering ginger tea and increasing fluid intake can help with nausea, but are secondary to the primary intervention of antiemetic medication. 194. A nurse is caring for a patient with oral cancer who is receiving radiation therapy. The nurse should monitor for which of the following complications? A. Xerostomia. B. Hypertension. C. Polyuria. D. Weight gain. Answer: A. Xerostomia. Rationale: radiation therapy to the head and neck can cause dry mouth, xerostomia, as a side effect. Monitoring for xerostomia is crucial, as it can affect the patient's ability to eat, speak, and maintain oral health. Hypertension, polyuria, and weight gain are not common side effects of radiation therapy for oral cancer. 195. A nurse is caring for a patient receiving chemotherapy who develops alopecia. Which of the following should the nurse include in the teaching? A. Hair loss is temporary and will grow back after treatment. B. Wearing a wig or scarf can help with self-image. C. Shaving the head can prevent further hair loss. D. Hair loss will only occur in certain areas of the scalp. Answer: B. Wearing a wig or scarf can help with self-image. Rationale: hair loss is a common side effect of chemotherapy and patients often experience changes in self-image. Wearing a wig or scarf can help the patient feel more confident during treatment. While hair loss is usually temporary, patients may benefit from emotional support regarding this change. 196. A nurse is caring for a patient with pancreatic cancer who is experiencing jaundice. Which of the following should the nurse assess for? A. Dark urine. B. Increased appetite. C. Decreased thirst. D. Increased body temperature. Answer: A. Dark urine. Rationale: jaundice occurs when there is an excess of bilirubin in the bloodstream, causing the skin and eyes to appear yellow. Dark urine is a common symptom of jaundice and should be assessed. Increased appetite, decreased thirst, and fever are not typical signs of jaundice. 197. A nurse is caring for a patient who is receiving chemotherapy for non-Hodgkin lymphoma. The patient develops a fever and chills. Which of the following is the nurse's priority action? A. Administer an antipyretic medication. B. Assess the patient's vital signs. C. Notify the healthcare provider. D. Perform blood cultures. Answer: C. Notify the healthcare provider. Rationale: a fever and chills in a patient receiving chemotherapy may indicate an infection, which is a serious complication due to the patient's immunosuppressed state. The healthcare provider should be notified immediately for further assessment and possible interventions. 198. A nurse is caring for a patient who is receiving chemotherapy and has developed severe fatigue. Which of the following actions should the nurse recommend? A. Rest frequently, but engage in light physical activity. B. Limit fluid intake to avoid fatigue. C. Avoid all physical activity and remain in bed. D. Take naps longer than 4 hours daily. Answer: A. Rest frequently, but engage in light physical activity. Rationale: severe fatigue is common during chemotherapy, but light physical activity can help prevent deconditioning and improve energy levels. Rest is also important, but long periods of inactivity should be avoided. Limiting fluids or avoiding physical activity are not recommended. 199. A nurse is caring for a patient with ovarian cancer who is undergoing chemotherapy. The patient reports vaginal bleeding. Which of the following should the nurse do first? A. Administer an analgesic as prescribed. B. Notify the healthcare provider. C. Provide reassurance to the patient. D. Assess the amount and color of the bleeding. Answer: D. Assess the amount and color of the bleeding. Rationale: the first action should be to assess the amount and color of the vaginal bleeding, as this information will help guide further interventions. Notifying the healthcare provider and providing reassurance are important, but assessment comes first. 200. A nurse is caring for a patient with lung cancer who is receiving chemotherapy. The patient complains of a dry, persistent cough. Which of the following interventions should the nurse implement? A. Administer a cough suppressant. B. Encourage the patient to drink large amounts of fluids. C. Assess for signs of lung infection. D. Provide a humidifier in the patient's room. Answer: C. Assess for signs of lung infection. Rationale: a persistent cough in a patient receiving chemotherapy could indicate an infection or a side effect of treatment. The nurse should first assess for signs of infection, such as fever, increased sputum production, or chest pain. Providing fluids, a humidifier, or a cough suppressant may also be helpful depending on the findings.